major presentation on ending HIV with persons with disabilities. And that will be by someone called Robert from the UNAD, the National Association of the Deaf. They are already setting up their presentation. And then we will have a discussion, the plenary, which will be a major part of the program. And once we finish that, we will break for tea. And during that break for tea, we will all move for about 30 minutes to the posters tent, that tent over there. That tent, we have been visiting it, but rather informally. Today, all of us are going to head there during the break, the health break, the break tea time, and we will have lessons to learn from there. The posters authors are already informed so that they can be ready for us and to teach us about the meanings and lessons in those posters. Once we finish that, we will have Honorable Kabasharira taking over from Dr. Watiti and from ourselves, the MCs, and we will then go into the testimony. So on your program manual, you may see Honorable Jessica Abaviku. She is not able to make it. It will be Honorable Kabasharira from Parliament who will take over from there. Then we will have another guest to come for the Philly Lutaya Memorial Lecture, and all this chaired by, the session chaired by Honorable Kabasharira will be from the Philly Lutaya tent, which is the other big tent with the red chairs that you see in front of me. Then after that, we will have a presentation of the aid memoir, and then statement by Uganda National Young Positives Association, then statement by the UN Resident Coordinator, and then we will have the closure. All that will be managed by Honorable Kabasharira. So I want to put us on notice that is how the program will run. Allow me now take the singular honor to invite Dr. Watiti to come and start us off, while telling those who are in the tents outside, kindly come to the main presentation tent and participate actively from here. Let's put our hands together, ladies and gentlemen, to welcome Dr. Watiti, a man who needs no introduction in the fight against HIV in this country. He has vowed and said his covenant with his Creator is to live up to 90 years plus. And he's now 70, and he said he has lived for over 35 years with HIV. And we recognize you, Dr. Watiti, in this struggle. We thank God for keeping you, but for giving you wisdom to continue sharing information and educating our people about HIV/AIDS. You're most welcome.
Thank you very, very much. Very much. Let's give him a round of applause as he takes it. I've been seeing him on TV now. We can see him, and he's got a lot of energy when he is leading us. Thank you so much. This is our last day, so this is the best of the best. So we are going to have a real great feast today as we do the final lap, and I'm really honored to be here. I will be taking my seat down there, but before I do, I want to invite my co-presenter, my co-chair. My co-chair is my friend Raymond Kcca, who is standing in for the Mr. Kentus, who is the executive director of our movement, the national movement, the National Forum for Living with HIV Networks in Uganda. So we will be I think, sitting there, and then we shall call our presenters who are already in the room. We are honored. We're going to have a great time this morning. Thank you very much. All right, this is working. Now we want to, let me first hear from my co-chairs. Say hi.
Good morning, ladies and gentlemen. Once again, we are very happy to see you this morning. My name is Raymond Kcca. I'm also very happy to co-chair my mentor, Dr. Stephen Watiti. Happy to see you all.
Okay. Let's take this time to invite our presenter from PEPFAR. See this, from PEPFAR Coordinating Office, Miss Rachel Kwezi. Miss Rachel Kwezi, please come and join us at the podium. You clap until she reaches because she's bringing. Not for us, for living with HIV, PEPFAR is like our singer. So when you are coming, you say, Auntie Uyo. Thank you very much. Right.
Yeah, we would like to call upon our other panelists from Uganda National Association of the Deaf, Mr. Robert Nkwangu. He comes along with the interpreter. You're welcome.
So when Nkwangu is coming, if you clap, he's not hearing, so you...
Yes.
He hasn't seen you all. Thank you very much. Thank you very much. Okay, with that done, we really want to dive into the real matter of this and why we're here. As I've already said, we people living with HIV, many of us know that without the coming of PEPFAR, we would not be here. I personally can say that. The coming of PEPFAR to Uganda was a real game changer. I remember at that time I just started working at Biolume and people were dying. Real dying, you know, you'll find on a day we would lose so many, like 4 or 5 patients. But with PEPFAR, the situation has changed. People who were dying are no longer dying. In fact, the biggest challenge now is how to live longer now that we are not dying of AIDS. And so we are really blessed to have you here, Madam Rachel Kwezi, on behalf of PEPFAR to come and speak to us on the 20 years of PEPFAR in Uganda, because I remember it was in 2004 when PEPFAR came to Uganda. And many of us who were young, I remember I did not have gray hair, now I have gray hair. So you have made me and many other Ugandans, on behalf of PEPFAR, welcome to speak to us about the 20 years of PEPFAR in Uganda. How we have seen it, but how have you seen it from the other side? Thank you. Over to you. Yeah, you can go and use them.
Good morning. My name is Rachel Kwezi. I work with the PEPFAR Coordination Office as the Senior Strategic Information Advisor, and I'll be going through a presentation on the 20 years of hope, impact, and partnership. PEPFAR is very broad, but today I'll focus on the impact of art, but we know we have made significant impact through BMMC, through PrEP, Kcca, and other system investments. Daniel, are you helping me with the presentation? All right, thank you. So we're going to focus on the scale-up of PEPFAR-supported HIV, ARV therapy, and estimation of HIV infections and HIV-related death. Not sure why. It's not.
Somebody from IT, come and help, please.
So let's reflect on the first case of HIV in Uganda. I think that was way back in 1985. We have made significant progress since then. And a big milestone for PEPFAR took place in January 2003 when President George Bush authorized PEPFAR to support this fight in ending HIV. And in February 2004, a Ugandan man aged 34 years received a diagnosis of HIV infection. The CD4 was 1 cell, and in April, the first person was able to receive PEPFAR-supported ART. That was in April 2004. And in 2023, as we speak now, this man is 54 years old. He remains on PEPFAR-supported ART. He's a teacher and a father to 2 HIV-negative children. So we wanted to also showcase like a summary slide of some of the top-line figures for PEPFAR impact in Uganda since 2004. We have scaled up ART by almost 5,000% from that one individual to where we are now in 2003. ART scale-up has been effective through programming, as seen by the drop in the prevention of mother-to-child transmission rate to below 2%. The viral load suppression rates achieving and sustaining the third 95. And finally, beyond our program data, we have modeled the impact of PEPFAR. That is what would have happened if ART scale-up had not happened. And it has averted 500,000 HIV infections have been averted, including 230,000 estimated infections among HIV-exposed infants. So now the question is, we have made significant progress, as highlighted here, and we are close to reaching the 395s. So some of the key messages we have today. Apologies, I think I'm having some technology issues, but just bear with me, we'll keep moving. So under the leadership of Government of Uganda and in strong partnership with stakeholders over almost 20 years, there has been incredible increase in PEPFAR-supported ART in Uganda, as shown by our program data. As you can see, this slide showcases right from 2004 how much we have scaled up putting people on ART from less than 200,000 to over 1.3 million people in 2002. And I think now in 2003, we are at 1.3 million people receiving ART.
Sorry, I want to interrupt the presenter for 1 second to announce the arrival of our key presenter today, the Honorable Amelia Chambade, former minister. She's here to represent the Deputy Speaker of Parliament, and she will be presenting the Philly Lutaya Memorial Lecture when we go to the next tent. Honorable, you're most welcome for this occasion, and you found when there is a presentation going on the role and contribution made by PEPFAR to the HIV/AIDS struggle, the last 20 years of PEPFAR in Uganda. So enjoy the presentation, Honorable. Thank you.
Thank you. You're very welcome. So we'll move on to our presentation. And there has been critical milestones in policy review to support art scale-up, including program designs that have happened since COVID. The key message is that there's been almost a 5,000 increase in PLHIV on PEPFAR-supported art, increased from 26,000, like I mentioned earlier, in 2004 to 1.3 million in FY22 and FY23, 2003. We have also shown that art is effective in PMTCT, and new infections have been driven down to less than 20%, and this continues to decline. And we are close to achieving virus suppression with a target of 95%, of all the people who have been diagnosed with HIV and are on art, achieving 95% virus suppression, even though the PIDs and the adolescents, as we look at our data, seem to be lagging behind. Art scale-up has been effective. PMTCT rates are below 2%. But what more can we do similarly, and how can we sustain viral load suppression at 95%? Let's look at some of the modeling data we use as PEPFAR. And of course, working in partnership with Ministry of Health. Modeling impact shows that there has been progressive increase in the number of HIV infections averted, as you can clearly see on the graph. Modeling impact also shows that there's been progressive increase in the number of HIV-related deaths that have been averted. In summary, 490,000 total HIV infections have been averted, including HIV-exposed infants. 230 HIV infections averted among HIV-exposed infants, 580 total HIV-related deaths averted. And this is all through the impact of putting HIV-infected patients on art through PEPFAR support. There's been tremendous scale-up of art, which has in turn effectively lowered PMTCT rates and increased virus suppression rates. And as mentioned before, averting over 500,000 infections and deaths. So every year we do annual planning of the PEPFAR program, and we review what we have done in the past few years and where we're going. So in 2023, as we planned for our programming, one of the questions we had is, where are we going together? And I'm going to summarize that in the next few slides. Fortunately, we have a path of how we intend to reach epidemic control as outlined by the strategies put in place. And what you see there as COP20, COP21, COP22. This is each year. COP20 would be FY 2020, 2021, 2022, and now going into COP23, which would be what we're going to do in the coming year. The PEPFARs start counting from October 1st, 2023, all the way to September 2024. So we have a path of how we intend to reach epidemic control, as outlined in the strategies you see on the screen. And currently, our focus is integration and innovation for person and family-centered programming. Integration with Government of Uganda systems and services. Second, holistic community engagement. Third, data for evidence-based programming. And fourth, commodity security. There we go. So let's start at the heart of our strategy with health equity. One of our pillars as PEPFAR going forward is health equity, and that includes closing the remaining gaps for children, for adolescent girls and young women, for key populations, and also finding the men. And we need to fulfill the program, what the program started in 2004. And we need to fulfill that promise for all, not just a few packets of the population, but for all. And we seek to close gaps among children, adolescent girls and young women, and key populations. And in the data that we have that showcases modeling, these are the key populations that are lagging behind and the key populations that have high infections compared to the overall general population. And our conversations have also highlighted that finding men is a key strategy to prevent infections among adolescent girls and young women. Fortunately, we also have a data-driven programming for health equity, and that includes multiple sources we use to analyze our data. Many of you are aware of how we do FIA, which is HIV impact surveys every 5 years. But we also have other population studies we do, and one of them that stands out is Crane survey, where they do biobehavioral surveys, and they particularly look at key populations and other hidden populations to understand, and we use that data to inform programming, and that helps us to effectively reach the undiagnosed population among the groups I have mentioned, which seem to be lagging behind. Another key thing that PEPFAR is looking at is community leadership. So case finding and prevention strategies will leverage the power of communities, helping their communities to reach the missing populations, to come up with youth-led initiatives, but then also clinical care will continue to decentralize and become integrated within community structures for more patient-centered care. Well, in the past, we have focused so much on the facility. Going forward, working together with Ministry of Health, we want to bring our services, and our program on community is a key strategy for global health security, helping to prevent outbreaks at the source, as well as rapid detection and response to bring outbreaks to a close as soon as possible. Can I ask the IT person to help me run these through as I go? Thank you. I'll just keep saying next slide so we save time. Thank you. PEPFAR will work in concert to strengthen the Government of Uganda approaches for holistic community engagement. By strengthening the frameworks that we all work under, we will advance and progress to the 95-95-95 and the 10-10-10 goals. We are continuing to align current PEPFAR programming with national community health strategy. We're integrating HIV within broader health services and systems, as well as strengthening civil society capacity. Next slide, please. Innovation. Now, this is also very key at the stage where we are to end the epidemic. We want to highlight the need for continuous program innovations around new science, as well as new drugs and technologies as they become available. We also want to ensure that innovations for program management, with an emphasis on one, speed, how quickly do we improve timelines for better outcomes, scale, ensuring that these are at scale and they're reaching everyone, not just a few pockets of people in the population, but scaling them up. Adaptability, becoming flexible, is needed for unpredictable situations. And finally, value for money, looking toward efficiency, the highest impact at the lowest cost. We have a long legacy to stand on, including adopting innovative technologies to end HIV. We have used audio computer-assisted interviews. This has been used mostly with the Crane survey, where as we do our research and as we reach the key populations in Uganda, we use audio-assisted interviews, where a health worker is not going to ask you questions, but you sit under a computer and you're able to anonymously answer some of the questions that would inform our programming. So we have found that we're able to get more information than someone would give if they were talking to a counselor. So these are some of the technologies we're using, and which helps with person-specific messaging for HIV services around risk reported in a confidential and acceptable manner. One of the other enablers, and I've mentioned this again, I'll mention it, and the emphasis is on leading with data. So it should be evidence-based, action-oriented, continuous, decentralized, and empowered decision-making. And we highlight the importance, you could go back to the previous slide. So here, the importance of not just having data for data's sake. So it's not just about having lots of data, because we really have a lot of data with the PEPFAR programming, with all the modeling that we do with UNAIDS and other development partners, but also with Ministry of Health. There's a lot of data that we have, but now we want to use that data for action. And our data use strategy emphasizes providing evidence on which we base decisions, making patient and program level changes for improved outcomes. It should be continuous and should be ongoing, and also should be decentralized so that people down to the site and community level can also find this data and use it to make decisions and empower decision making. Next slide, please. So moving forward, we can go to the next slide. Moving forward, we have data science and informatics key priorities, as highlighted on this slide. And most of these are governance with leadership, alignment and coordination, skilled data workforce, strengthening facility and community data systems, optimizing analytics for actionable insights, and elevating the science. Next slide. And then one of the other major pillars and what we're focusing on with PEPFAR programming is sustaining the response. So we can do a lot, but we would like to work together with the government to ensure that everything we're doing is sustainable. Everything we're doing, the government is taking the lead, and we are working together with the government. So sustainability is the name of the game going forward, and we look forward to integration to find efficiencies within our PEPFAR program, as well as within the broader health system through alignment with Government of Uganda and key stakeholders. And we recommend acknowledging Government of Uganda's commitment for working together with us to end the HIV epidemic. Moving forward, next slide. We have a good precedent for how this has been done successfully, and this is just one good example of how we have worked together with Government of Uganda and Ministry of Health, and that has been the 10-year supply chain roadmap where, you know, PEPFAR, Government of Uganda, and other development partners came together and came up with a work plan for supply chain, a 10-year roadmap that has principles on how this can be sustained across the 10 years. Next slide. And then one of the other major pillars that we're focusing on currently is public health systems and security. First, for public health among people living with HIV, we need to ensure our large patient cohort is protected and there is continuity of treatment during public health threats. And second, we also want to recognize that Uganda is a unique context for global health security. And this includes the unique epidemiologic context with diseases like Ebola, Rift Valley fever, which are also of global health concern. And the unique epidemiologic context is counterbalanced by long-standing investments that have created a strong cadre of human resources, world-class surveillance and lab systems, and effective supply chain and waste management. Let's move on to the next slide. So transformative partnerships is also another key thing that we're working with as PEPFAR, and we emphasize that the goal is to end HIV together. So we can't do it alone. So we need community partnerships are key. Engaging communities in all their diversity must be a priority to enable participation and inclusion, and we recognize the need to align with Government of Uganda engagement strategy, innovating, including finding innovative financing mechanisms, seeking models that move the HIV response in Uganda from donor-financed response, such as to other schemes, you know, that would handle financing. Then private sector approaches, including, you know, programming and financing as well. Next slide, please. We are glad to see that Government of Uganda has a vision for how partnerships fit into the larger sustainability strategy. And we'll continue to work with them, and this has really been a key focus going forward. And we'll have more discussions on sustainability in our coming planning for the next COP year. Next slide. So wrapping up all the pillars that we're focusing on as PEPFAR is really follow the science, which is close to what I mentioned about leading with data, but, you know, the legacy of science in Uganda, including initial trials on nevirapine to prevent vertical transmission, circumcision as HIV prevention, treatment as prevention. This has not only impacted programming, translating into lives saved in Uganda, it has also fundamentally impacted HIV policy and programming around the world. And we're continuing to working with the follow the science pillar, working with surveys, and these include, we have the IBBS survey going on. It's the integrated biobehavioral survey that focuses mostly on key populations. We have the ILFIRA survey, which is going to come on in the next financial year, 2024, the HIV drug resistance and phylogenetics study also ongoing, and transitional science such as long-acting injectables in a program setting. So all these surveys and trials we're doing fitting into our strategy to inform programming for HIV and also ending the epidemic by 2030, reaching the 95. In conclusion, we are excited to integrate approaches with Government of Uganda, with our other health development partners, with the civil society, and we're using the PEPFAR 5x3 strategy, which you see there. That is all the key pieces that we need to work on: sustainability, partnerships, community, health equity, innovation, data, global health security, and science. And partnership will help us focus on goals for 2025 and beyond, and together we can end the HIV epidemic in Uganda. Thank you.
Thank you very much. Thank you very much, Madam Rachel Kwesi, for that presentation. We apologize for the glitches, but you did a great job. Let's give her another round of applause. I must also apologize that I actually jumped. I was supposed to do a recap. But you know, for me, when you talk about PEPFAR, then put recap and other things, I go for PEPFAR first. Of course, somebody who picks you from a pit and makes you live, really you cannot forget. I will never forget PEPFAR. Thank you very much. And while we're at it, we know that we belong to the government of Uganda, and as the Baganda say, Nanyi Mufu, Akwata Awaunya. So we do request, of course, as we thank PEPFAR, that our government steps up and invests more into health. Many of us who are now contributing positively to national development would be dead without PEPFAR. And we can do better. We can continue doing this with the more funding. I now want to hand over to my co-chair to introduce our next speaker. After that one, after the next speaker, then we shall do the recap. So those of you who came late, you have gained from my misbehavior, but you will get the recap also. Thank you very much. Over to you.
Yeah, thank you, Chair. And, you know, I love the bit of community engagement, and the other word is holistic community engagement. And at this point, we would like to hear from the Uganda National Association of the Deaf, looking at basically ending HIV with people with disabilities. You are welcome, Mr. Robert Akwangu.
You come and sit here and use the mic here. You know we have to, I'd forgotten. He will be voicing, but he will be the presenter, sorry.
Excuse me. Yes, that's fine.
Here or here?
It's fine.
Is better, here or here?
I'll be here. I'll be
Here
here.
is better.
Yes.
Space. You see.
Yes, thank you very much, Mr. Chair, Dr. Watiti. Good morning, ladies and gentlemen. Good morning, all of you. I'm deaf. I do not hear. And I would like to teach a few sign language to you. Let's sign together. Good morning. Good morning. Yes, thank you very much. You know, when I look at you, I understand the feedback that you've given me. Thank you very much. My name is Robert Nkwangu. I'm the Executive Director of the Uganda National Association of the Deaf. Some of you have been asking what UNAD is all about. UNAD stands for the Uganda National Association of the Deaf, registered by government. We have been in existence for the last 50 years, since 1973. And you're working towards promoting the lives of deaf persons. I use sign language, and I've borrowed the voice of Mr. Wycliffe Bukenya, who is my sign language interpreter. So sign language is very key as a mode of communication for people like me, and it aids us to access communication, participation, and also holistic development. UNAD implements different programs in 5 thematic areas. One, being sign language and communication, will help deaf persons and government in accessing information. As you can remember, Uganda has over 1.8 million deaf persons in Uganda, and the key challenge is communication and access to information, and many times we've been left behind in different programs because of the communication laxity. And that's why it's very, very important to popularize sign language to help the deaf persons learn from all the programs. And also the aspect of gender is very key, and education that we do. And also we do influence advocacy and make sure that issues concerning deaf persons are embedded within the laws and policies in Uganda. And finally, the livelihoods to help our people lead decent lives. When I was coming in here at the desk, I reached the registration, and they were struggling to communicate with me, how to be helped, where to sign, and then people were just whispering to me, and they were speaking louder, and it was very big tense. And then finally I was led someone to come and help me to lead where the deaf persons are. I mean, all that struggle, I thought it would be very, very important for us to understand what disability means and how we can work together with the persons with the disabilities to end HIV, especially when she talked of, when Rachel talked about Pillar 4. An impairment, for starters, is a functional loss of the body. It may be the ears, maybe the eyes, maybe the legs, maybe the limbs. That's an impairment, a functional loss. Then a barrier is an environmental limitation. Where communication becomes limited, take an example, without weekly fear, and I'm only signing, there will be a communication gap. And equally, I and you may not participate and benefit from what I'm doing, but with weekly fear, we are doing away with the barrier. So I want to thank UAC for having this sign language component in their programs. Now, disability is when an impairment with a barrier come into play together. That's when a disability happens. Therefore, disability equals impairment plus a barrier. The Convention on Rights of Persons with Disabilities, it says persons with disabilities include those with long-term physical, mental, intellectual, sensory impairment, which in interaction with the various barriers may hinder their full participation and effective participation in society on equal basis with others. As you can see, in Uganda, we have 12.4% of persons with disabilities. And if we use that data from UBOS, and that is estimated to be around 6 million people from the entire population of Uganda, which means it's a group that cannot be neglected, especially in the fight against HIV/AIDS. And I believe it's a group that can ably contribute towards ending this disease. When you talk of the young people, you talk of talk of the women, the children, these categories, but then we forget the idea of persons with disabilities, and I believe it is high time we had them in our programs to help end HIV by 2030 as our agenda. Persons with disabilities are classified into this Washington set of questions, which are usually 4 in nature, and these are internationally accepted. Difficult in seeing as a category of persons with disabilities. This includes the low vision and the totally blind. The second is a hard of difficult in hearing. For example, someone like me who is deaf. We also have a category of hard of hearing, difficulty in moving or using part of the body. These are the physical disability. We call the physical disability. And finally, difficulty in remembering, and of course, also concentration. So these are people. These are not mad people like we normally call them, but the different categories of persons with disabilities who need to be part of the fight against HIV. How do we mainstream programs. Remember, the Sustainable Development Goals clearly explain of leaving no one behind. And 4 out of the 17 goals talk of inclusion. For example, access to education, sexual education inclusive of that, and how issues concerning disability can be catered for. The second goal is number 8, is decent work and employment. And also productive inclusion. So all those, goal number 3, which is goal number 10, reduction in inequalities. The social, economic, and political inclusion of all persons. And finally, goal number 17, which is partnerships. And that ideally means working together to address the gaps within us in ending HIV/AIDS. Chair, I'm rushing, forgive me, I'm rushing, but because I'm using another language, I'm a little bit slower, but if you feel I'm rushing, please, you can slow me down. The key issues that we have is 1, persons with disabilities are at risk of HIV/AIDS. We are very vulnerable and at risk. You know, in our society, there are different myths in society. Those that we do believe that say if you have a sexual intercourse with someone with a disability or an albino, you get cured from HIV/AIDS. People think that persons with disabilities, we do not enjoy sex. We do enjoy it, by the way. We do. And women with disabilities are at risk of being raped because they're vulnerable and cannot defend themselves. And this applies also to the young girls with disabilities. And that is why HIV amongst our community is getting higher and higher, because even the negative attitude that the community has towards us, we are really stigmatized. Because, take an example of the deaf people. We live in a society, and our sexual network is within that small group of people. And with this network, we are scaling it out to the rest. So we don't access information on TVs, the radios, you know, all the information about HIV that's always out there. It's normally not accessible to us. And a small attention is given to persons with disabilities. As point number 3, little attention has been given to the challenges, and also persons with disabilities are both vulnerable, have a double vulnerability, because one has a disability, and 2 is suffering from HIV. So the society is going to judge this person extremely hard and harsh. Even many have not accessed education, not gone to school. Comprehending the written literature is quite difficult for them. As you can see, I'll give an example of the deaf people. Mr. Chair, when you come to our society, when one is HIV positive, is going to go on rejoicing, because in a layman language, something positive is something good. Because I'm positive, I'm rejoicing. I've won the exams, I've gotten a plus, I have an A+, I'm good. But yet, in the real sense of positivity with HIV, is something bad. Yet for us, we are rejoicing because we are positive. And the negative, I'll go crying because I'm HIV negative, because we don't know the depth of all this language. So the community needs to understand this information, especially from people like me. And 90% of people like me have never gone to school. And this category cannot be neglected, ladies and gentlemen, in the fight against HIV. And also, the medical practitioners, the nurses and doctors, I mean, the mode of communication towards people like me when you go to access services is quite tense. When the person comes, from my experience, at the registration, you know, the people that struggle to talk to me there, it really shows what happens in the medical centers. So a few deaf persons and persons with disabilities at large usually go for services because of the stigma, and we normally die in silence. In summary, there are key barriers that we need to tackle. One, the attitude. If we tackle the attitude, especially among the health workers and the community, at the family level, looking at persons with disabilities as secondary citizens. Two is if we address the aspect of communication, what we are talking about, putting it in accessible formats would be great. Then three, accessing. The health centers, are they accessible? The physical accessibility, and also the information accessibility. And then fourth is participation. So call upon government in how we can end HIV/AIDS amongst persons with disabilities, and together as a country. One, I feel to be very, very important to mainstream HIV programs. I'll be happy, and I want to record Madam Guest of Honor. A few weeks ago, Uganda AIDS Commission translated the policy guidelines into sign language and also Braille. And it's the first of its kind into this country to have this information accessed for persons with disabilities, and it is easily understood because we know we can end HIV, and also the blind people can also read in Braille on this literature to attain HIV. And the next step moving forward is how we can roll out all this information for the benefit of all our people out there in the country to understand what we are talking about. And also persons with disabilities need a peer-to-peer engagement. If we empower them, such that deaf persons can talk directly to you, Mr. Chair, in sign language without Wycliffe, the interpreter, if we can talk to, because we need to have some private conversation between you and me, and then we don't want the third party to be part of our conversation. So we really need that if we have peer-to-peer engagement and sensitizing one another to communicate how we can see we can mitigate all these challenges and ministers. That will help reduce the stigma. A call for data. When we get some donors, they usually ask us, how many persons with disabilities are having HIV/AIDS? How many of them are accessing the services? So one donor asked me to go back to government or the health centers, the Ministry of Health. When people are recording at the registration, when they're recording their gender, their age, where they're coming from, they never ask the aspect of disability. So I think in that capturing of data, it is high time we had an indicator that captures disability moving forward within this data that we are collecting. And also different categories of persons with disabilities. If one is a physical, if one is blind, one is deaf, one has a mental disability, let us capture all this information, especially when they are registering to get this information. And secondly, the guidelines on how service providers can mainstream disability into their programs. And also the voices of persons with disabilities being heard. Because I believe we are good representative of our constituencies. Like we normally say nothing for us without us. And I believe if you are brought on board, we can ably know how we can control and we can control our people, because it will be very important, because once we listen to people like us, they can ably change their behavior. And fourth, the budget allocations. If we could have an element of a disability eye in allocating budgets, making the health centers accessible, both in the physical and sign language interpretation, having the health workers trained into sign language and other things, and also having a network with a partnering with the persons with the disabilities, the organization, the OPDs, and that can help because they can mobilize their members. And finally, Chair, forgive me for running very fast, but for any issues, please, persons with the disabilities, we are ready to partner together to end HIV/AIDS, and it is a group that cannot be left behind. 6 million plus persons are quite a very big number that we can't forego in the fight against HIV/AIDS. Thank you very much for the opportunity given to me. Robert Nkwangu, thank you very much.
Wow. Let's once again show a sign of appreciation to our presenter, Mr. Robert. Thank you very much. Yeah, at this point, as our technical team prepares the recap, those with questions, please be noting them down. And after the recap, we shall get to the questions.
Let's give a round of applause to the recap. The USC who are coming to remind us of what we did yesterday. And for those of us who were not able to attend yesterday, let's take advantage of this. Thank you.
Thank you very much. Good morning, everyone. We thank God for the good weather, surely. Can we clap for God as we wait for the, yes. My name is Masimbi Brian. I work with Uganda AIDS Commission as a data manager. I'm going to present the highlights of the day. These are just some of the highlights. We had plenary sessions, and also we had breakaways. Yes, some of the key issues that came up, one of them was HAHA has been misinterpreted by majority of us. The Ministry of Health has come up with a national adaptation plan, which has tried to mitigate the impact of HAHA. This is the Anti-Homosexuality Act in the health setting. Then also we learned about the long-acting ART, which is, for now it's still being used in the West. But JCRC has carried out studies on the long-acting HIV treatment and cure. And this has been basically on the RCT model, the random control trial model, whereby it has the CARE study, the Impala study, and the FRESH cohort. So studies are ongoing. This is because we don't want to be left behind, as it was when the ARVs came to Uganda after 17 years. So this time we don't want to be left behind, but also there is a gene therapy that is being adopted in Uganda that is also part of the HIV cure. And also we should note that majority of the presentation has presented on engaging the communities in all aspects of treatment, prevention, reduction in stigma, and positive living. And an example of JCRC where they have developed a brochure to sensitize the communities about the cure. Then also, favorable legal environment came up during as a key highlight, where some sections of the law should be repealed that criminalize HIV and AIDS should be repealed. And also, Uganda AIDS Commission has come up with an accreditation and e-mapping system. This is for the civil society organizations. Also, it was noted that HIV and AIDS mainstreaming in the public sector is providing an avenue for additional HIV and AIDS funding on top of the donor support. And also across all the presentation, the social support was presented as a different medication for people living with HIV. So we should, as we focus on the care and treatment, as the magic bullet, as they said yesterday, also social support should be highly considered. In this case, the people living with HIV networks should be revitalized as it was before, because it gives hope. It's an altar for these people, so it should be brought up again. Then the stigma and discrimination in schools is still high. We need to find a solution to that. Then the economic support also came up in almost all the presentations yesterday for the people living with HIV, especially for women and young people. As we know that right now the society we are living in is still patriarchy, whereby the resources are owned by men. So these women are left behind in that aspect. Then there is need to implement a robust HIV prevention, care, and treatment, including the PMTCT programs in the prisons setting that came up. So we need to think about these people in the prisons. And then there is an aspect of efficient and effective use of the resources for HIV. We should try as much as possible to avoid wastage of the resources. And then the sustainability plan, after 2030, what next? We need to sustain what we have gained so that we don't fall back into the trap. Then we need to engage the private sector to come up with a way to channel a portion of their community responsibility to HIV. Here we need to sit on a round table. And also the aspect of the decline in provision of information on HIV came up. It's not the way it was before, so we have declined a bit, so we need to pull up our socks there. This one also came in the community, in the community aspect. Lastly, one of the presenters talked about the investing in prevention interventions pays more dividends in the long run than care and treatment. So members, we need to think about investing in prevention rather than waiting to invest in care and treatment. Thank you very much. That's where the key highlights. Thank you, Chair.
Thank you very much. Thank you so much for the recap. Those of us who either missed it or were not here yesterday. Now, of course, as my brother was presenting, I discovered that I have a disability which I had forgotten, the difficulty in remembering. And this is a real problem, especially as you grow older, but it's going to be so sometimes I find it challenging. But on a serious note, we need to think more about this, because as people grow older with HIV, and they develop this difficulty in remembering, the question is, how do we expect them to remember to swallow ARVs every day when they are not sick? And this is a real big problem. So we could end up where we began if we do not think about this and look out for ways to solve this problem of difficulty in remembering. Yeah. Something to think about. Now, but now the issue is we have time for questions for Madam Rachel and for my brother. If you have the questions, please put up your hand, or if you have written it, send it to us so we pass them to them. But as you do that, you know, recently we had a real big problem when we heard that there might be no funding for PEPFAR. Can we hear from you that this funding is going to go on, or because I know you, the way you talked, but it was not in your presentation, because, or was it there? Maybe I missed it, or maybe I've forgotten. Can you reassure people living with HIV? You know, I say this because I'm the chairman of the National Forum of People Living with HIV Networks. Never mind that from next week I'll not be, because there's going to be an election and I'm not going to be, so you'll be referring to me as the former current chairman. But anyway, my question is, can we get assurance that we are going to have this money for some more time, please?
Thank you, sir. I think our ambassador has spoken publicly that that will continue, but there will be changes, and those changes will be communicated with the government.
Thank you very much. There is going to continue, but we shall look about the but later. So we have to do a lot of work with our government to take over this. We are Ugandans, and we must keep living until God calls us eventually at the end. But not through AIDS, surely not. Any other question, please? That was just filling in as you put up questions. Okay, there is no question. Two things. Either they were so clear that everything was understood, or maybe they were not understood. There is a question. There's somebody with a microphone. There's a hand the other side. Yes, one hand there. A hand from a gentleman. I think that's Mr. Magala. Yes. You'll soon have a microphone and ask your question. Direct to the person clearly so that they are able to answer you. Thank you.
Sorry.
Thank you, Chair. And thank you so much. Our PEPFAR, you referred to her as our auntie. Quite a lot of lives have been saved, very productive, and moving on with life. So these are some of the wonders of PEPFAR. You indicated that evidence and data drives what you do or what everybody does. Great achievements that you have shared with us. I'm wondering whether in the course of the 20-year implementation, working together, whether some of the data has come out and there are areas of improvement or areas of innovation. So perhaps hear from you, how has data improved the implementation of PEPFAR program? Thank you.
Thank you very much for that question. Yes, I agree. Data has been very useful in informing PEPFAR programming, particularly for art. Every year we focus on understanding where we are in the cascade. As you're all aware, one of the goals to reach by 2025 is reaching the 95, which would be 95 of people living with HIV have been diagnosed, and 95 of those have been initiated on treatment, and 95 of those are suppressed. So one of the things we do is we analyze using the program results that we collect from within the Ugandan facilities to understand where are we with the cascade. And the last time we did that analysis, we're close to the 95, we're not yet there. And one of the things we've done is what are those major strategies we need to do to close the gaps. Also, the analysis has been able to help us understand who are the missing populations and who are those populations within Uganda that are having challenges with new infections, with maybe not adhering, and one of the major populations that has come up is adolescent girls and young women, and I know that Uganda AIDS Commission is doing a lot of work there as well as UNAIDS to ensure that we're reaching the adolescent girls and young women with different packages. PEPFAR as well is implementing what you've heard of as DREAMS, and really the major focus of DREAMS is to empower the young girls and ensure that they can do what is right for them, but also reduce incidents among that age group. So there are many things we're doing. The other one that stands out is, viral suppression has been low in men, younger men, and our programming is geared, of course, working together with Ministry of Health on how we can improve these, the QI approaches that are discussed within the different technical working groups, at ACP, whether for treatment or for prevention, and we're doing a lot. And then for prevention, really we're focusing on, how we're using prevention strategies like PrEP, VMMC as well to reach the adolescent girls and young women, to reach key populations, and also to help reduce what we're seeing as incidents in the population. So we're doing a lot with the data, and we're going to continue to do that to guide programming. And I think one of the latest one I can mention is that we're working with Ministry of Health to begin early discussions on, HIV impact survey. Thank you.
Thank you very much for that. We soon have. Oh, you have a question there? Okay, lady. Sure. Yeah, maybe the last one because we are behind you, but please.
Okay, thank you so much. My name is Nashiba. I work with African Youth Development Link, and we work with young people. And currently we are implementing a project geared towards improving the good health and well-being of adolescent mothers living with HIV. And mine is not necessarily a question, but maybe a comment. So I just want to thank Mr. Nkwangu for the presentation and the feedback, but also to call upon the practitioners and actors to not necessarily to view the persons with disability as victims, but to view them as equal partners in the fight against HIV. Because among the adolescent mothers we work with in Bujiri and Busia, we have some of them with disability. And for them it's a double disability because they are teenagers, they are young mothers, and at the same time they are positive, but at the same time they are carrying a disability. So I believe we need to put it into consideration that they have a lot to offer, so we should engage them as partners, not necessarily as vulnerable people. Thank you.
Thank you very much. Thank you. Okay.
Let's take one now. We have time we are fighting against.
Yeah, thank you very much. I'm John Maogole, a clinical officer from Kabaramaido, but also a palliative care specialist. From our last presenter mentioned about vulnerability, but I would like to note that PEPFAR has been focusing on vulnerable children, and vulnerability is cross-cutting. It is from starting of age to ending of age. It is throughout life. It comes with the life-threatening illnesses. It comes with a lot. So I would like to also call upon PEPFAR to encourage the implementing partners to widen the vulnerability coverage from children to the wider community. This will help us scale up HIV identification. Thank you.
Okay, I think that's a request. We, of course, asking for much, but We certainly are appreciative. In your presentation, you mentioned about holistic community engagement. One of the things we living with HIV have been asking especially is the issue of funding treatment literacy programs, because a lot of our people are struggling. You know, it's not very easy to try medicine when you are not feeling sick. And these are some of the people who have never suffered from anything, but they have HIV and they need to swallow medicine. So they need to be trained regularly on how to keep swallowing medicine when they are not sick through treatment literacy programs. But thank you very much. Thank you. Let's give a round of applause to our presenters. And a round of applause to you for listening very well. Thank you very much. And on behalf of my co-chair, we want to thank you for allowing us. You can also applaud. Over to you, MC.
Good morning, ladies and gentlemen. A round of applause to our session chairs. Dr. Watiti Stephen, thank you so much. And Raymond Kcca from the National PLHIV Forum. I also want to thank our dear panelists from PEPFAR and UNAD. That was quite insightful. And I believe we as civil society, as government, shall be considerate of the key actions recommended, because inclusion is very key in the fight against HIV. At this juncture, I want to invite us for a health break. We are going to have our tea at the poster tent, and we shall be interacting with the poster presenters. I know you've been informally touring the poster stall, but I invite you all, and then I think we should have a tea break of 30 minutes, if you may allow. And then we shall be able to go to the Philly Lutaya corner, and I will invite the Director General, Acting Director General, to lead our delegation and our guest of honor after the tea break for the Philly Lutaya session. That will be marking the end of the National HIV/AIDS Symposium. Thank you so much. I would love to invite Reverend, I don't know if you have Reverend around or Sheikh, to give us a word of prayer and bless our tea. Thank you. Oh. Do we have anyone that can? Yes, please, you're welcome. As our tea blesser arrives, I want to make a little announcement. So we shall have our invited guests. We have the guest of honor and her team have break tea at the, we have a lounge there prepared for her. And then the rest of the stakeholders shall be directed by the ushers the point at which they'll be able to get their health break. Thank you.
Let's humble ourselves and we pray. Father, in the name of Jesus, we thank you so much for the gift of this bright new day. We thank you for all the discussions which is going on. Father, we come to you as your children. We want to commit ourselves to you to serve our country, Uganda, and the whole world in fighting against HIV and AIDS. We thank you for all the presenters. We thank you for the participants, O Lord. And Father, we continue to commit this day to you, that you will continue to speak to us through the different facilitators. We thank you for the gift of the breakthrough which is set before us, O Lord. We remember those who do not have what to eat, O God, that at the appointed time you will provide for them. And for us who have what to eat right now, I pray, God, that you bless and sanctify that which is set before us, O Lord. As we partake of it, O God, shall it nourish our body to gain the strength to continue doing more and more. We pray even blessing upon those who have prepared it, that your hands of blessing be upon them. We pray all this, O God, believing and trusting in your Son, Jesus Christ, our Lord. Amen.
Salapulesa nawe ogenda kwa tate banchawe ngakundeze katinda kundezeleze nyamba kundeze ngakundeze kwano kundeze ngakundeze nyamba kundeze ngakundeze nganinda 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 Ganida, 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 Ganida. Dasabimana Omwaka guno bobango sumulolo mukisa Sandikira kuze Kusaba chimbu mukama bobango kola Sandikira wange Omwaka guno bobango gabe birungi Sandikira kuze Kusaba chimbu mukama bobango kola Sandikira wange Waliwe mbera chinkoye Obulamu bwange Ekera kumacho mulimu nengunonya Tegekera abana bangolo nensiba anentawula Obudde okusiba Sawa y'okunyuka entuuka Anezinzizayo wakasiri nalandiro nti naye ndize bumweza mbe bubi mikwano gyange baganda bange bwe bakyalayo mpulira embeera nkikuyiye no saba mukama ottase nange imana yanje omwaka guno bw'obanga osumulula omukisa tandikira kunze kusaba kimbu mukama bw'obanga okola tandikira wange omwaka guno bw'obanga ogaba ebirungi tandikira kunze kusaba kimbu mukama bw'obanga okola tandikira wange mukama nkusaba ntemera oluwenda sobola okugenda mu maaso abanjiganya nabo bangi tekusaba baswaze mukama ng'okolera nze waleti yange naye nekyula abaana bange banasanyuka ne mukyala wange yanegereza abakinedda kubanga mukama nkwesize ogenda kunkolera omwaka guno bw'obanga osumulula omugisa tandikira kunze kusaba kimbu mukama bw'obanga okola tandikira wange omwaka guno bw'obanga ogaba ebirungi tandikira kunze kusaba kimbu mukama bw'obanga okola tandikira wange kiro saba mpa omukisa leero ogaziye n'ensalo zange nga bwe wakola jabezi n'ogaziya n'ensolo ze zonna rediyo talusisi eneeba egamba nti wagwamu rediyo ninebe eyogera nti yo blessed omwaka guno bw'obanga osumulula omugisa tandikira kunze kusaba kimbu mukama bw'obanga okola tandikira wange omwaka guno bw'obanga ogaba ebirungi tandikira kunze kusaba kimbu mukama bw'obanga okola tandikira wange omwaka guno bw'obanga osumulula omugisa tandikira kunze kusaba kimbu mukama bw'obanga okola tandikira wange omwaka guno bw'obanga ogaba ebirungi tandikira kunze omwaka guno tandikira kunze kusaba kimbu mukama tandikira wange omwaka guno tandikira kunze kusaba kimbu mukama tandikira wange omwaka guno tandikira kunze kusaba kimbu mukama bw'obanga okola tandikira wange mubakaza bangi mu nsi n'olonda mu wange omuntu gwe nesiga nenkulaga buli kyange n'okimanya nti mukyala wange gwe mutima gwange n'otonsasira kati ffenna tutabudde omukwano gwaffe gwonna guyise n'abamaka gaffe ogatabudde wali muntu gwenna w'ekitiibwa ndowooza olina amagezi n'okutwala ewakange saamanya nti wali mwenze kaloswaza batasobola nakwenyima laba ne mu kibuga jjukira nze nakuleeta emikwano gikeese ono yasendwe yatamaka gatute koyagayaye agatalina bwesibwa nebbanga lyewamala wensesasesa omugulira obulabo nga bwesibaawo olwo musiiba mu birabo ega amasimu genawoleranga omukubira ekiro kale mama singa nkukwata tuyinza okuvaawo nenkusotasota enkulaga omuliro nga nkuyigiriza obutagwana bakabano okumayo manyira mu nyumba yange n'abaana bange balaba mama waabwe ne mukwano gwange mu kisenge kyange njiko emikwano kinkese oyatunuulira mukyala wo nga yensisa yesituza omwana wo nga tolina nabwo omuyita bano bannamulabya senta ewa maama tebige oyatunuulira baby wo yatunuulira baby wo yatunuulira baby yatunuulira baby yatunuulira mukyala wo yatunuulira baby wo yatunuulira baby yatunuulira mukyala wo
Over the mountains down to the hill, I'm waiting, my baby coming for me. Oh, my baby coming for me. Oh, my baby coming for me. Under the weather, rain or the sun, no matter the weather.
Hello.
Mama, we are very humbled here. This is the Philly Retire Memorial Exhibition, and these are some of the legends we have. There is Frank Mbalile. This one was with us here. This was his last performance before he actually died in Amsterdam. He's the late Same Kasule with legend Moses Mato. He would be here, but they're now setting for Busoga big function. And this one is Supercharger, who has been a very strong person, advocate in terms of adherence. Last year, we were humbled to have Mama here. There was a time when we actually, Uganda's Commission organized, and we had Yvonne Kcca as one of our performing artists. We also knew that just as time goes, we will grow and we have to mentor some young artists to sing with us. These are women who are positive, and that's why you are having women at 40, because we know HIV has been here for quite a certain long time. So women felt they still have a voice to make to us all. Since AIDS started up to today, women who have been having HIV for 40 years are now still in existence. So this is what they have. And there, the one at the back, we know one of us here, or a friend, you've lost a friend, you make sure you write the names of those women who were with part of them by that time, since 1982 up to today. And here is, Fide is actually a very gifted person. He was a drummer, he was a composer, he was a saxophone player. This time he was with his friend called Bile Mutebi, and you see him making the drums. We actually had Frank Mbalile, but because of the busy schedule, they are quite busy. This was when Fide was in Makerere University. This was Fide and Same Kasule. You see Fide as a very, very young boy. So, and here is Fide with his friend Frank. They were coming from Japan, and they're now, we look at that man as a special person because he's one person who can play drums, he can play guitar, he can play saxophone, he can play keyboards, he could sing and compose. That was the Fide we are celebrating. So I just wanted to take you through that, and we are very excited. Thank you.
Let's put our hands together for Joanita Kawalia for the work you're doing of advocacy, using talent, using music. Ladies and gentlemen, let's put our hands together to receive our guests of honor, Honorable Amelia Chambade, together with Honorable Naomi Kabasharira. Honorable Naomi Kabasharira is going to chair the next session. I will be briefing her shortly. And Honorable Amelia Chambade, who is a senior presidential advisor on industry, is going to make a keynote presentation of the Philly Lutaya Memorial Lecture. Ladies and gentlemen, let's put our hands together for them. Thank you, thank you. Allow me start with thanking the barbed wire band. Thank you, great, you guys have been good. And we are still going to get more from you. We are not tired of catching more, entertainment, edutainment from you guys. You have done great the last 3 days, starting on Tuesday when the symposium kicked off. Joanita, thank you very much, and your entire team for continuing the fire burning, the fire lit by Philly Bongole Lutaya. Indeed, legends never die, and you have kept him alive to remind us all, the young, the old, the mid-age, everybody that lives in this country and beyond, that HIV/AIDS still lives with us. It is with us and it is within us. We must continue the fire in order to fight it. And never forget, the question of this symposium is, what is your responsibility? Ask yourself, what is my responsibility? You know that action in the church, mea culpa? Now, point at yourself and ask yourself, what is my responsibility? Some people are not doing it. What is my responsibility? And that is the question we are asking ourselves. I want to thank Martha Clara, who have been part of the team here. Where is she? Martha? Martha, stand up. Maybe she has stepped out. I want to also recognize Paul Achaye. Paul Achaye has been part of this team. There is Sebagala Andrew. Sebagala is right there, together with Joanita and the guys I'm reading. These, our guests, these are some of the persons who have kept this tent very alive since Tuesday. We also have Katushabe Brenda. Katushabe Brenda is here. She will be assisting with the emceeing as well. Then, of course, the big guys, the barbed wire band, they have been entertaining us here since Tuesday. We have DP Katumba, what is he? DP Katumba, here. Aloysius Matovu Joy, I haven't seen him around. He made a presentation the other day. Is he here? He is moving around. He will be coming to join us. He made a presentation the other day. And then we have the university team that we have to recognize. We have Golo University, representatives of Golo University, Makerere University, anybody from Makerere University? Those ones. You hear them. Now, Now, they told us at Makerere that once they start that, you don't interrupt. That's why I had to let them finish. Thank you very much, OBs and OGs. Chambogo University. Aha, make yourself also present. Chambogo University, do something. Ah, he's eating. He's still eating. Nakawa, Mobs. Mobs. Mobs, you're the neighbors here. Who are from Mobs? Aha, Mobs. Do you want to swear? You are the gentlemen, eh? And ladies. Okay. We also have had Mild May. Mild May, representatives from Mild May. Okay, thank you, Dr. Watiti. Reach out. Reach out. Aha. Thank you all very much. I want to also, in the same vein, recognize in a special way our gallant soldiers from the UPDF. They have been part of this for the last 3 days. Thank you very much. And allow me, ladies and gentlemen, to recognize in a special way Dr. Vincent, who is representing the Executive Director of the Uganda AIDS Commission, the people and the entire team of USC. Kindly stand up. USC, Uganda AIDS Commission, entire team, kindly wave to the people. You guys are great. Thank you very much. Thank you all in your various capacities for making this a frequent celebration of the struggle that we have against HIV/AIDS. Allow me also recognize the chairman of the Uganda AIDS Commission Board, Dr. Eddie, together with Professor Nam. They are all here. Thank you very much. Let's also recognize Dr. Watiti. You, the young people, must not lose hope. That gentleman told me and told us the other day in his testimony, he was confirmed with HIV when he was only 35 years. Today he is 70 years. Can't we thank God for him? And he said he has made a covenant with his Creator that he will live up to 90 and then say, God, now I have done my part. You can now do with me as you wish. Thank you very much, Dr. Watiti, and may you have abundant life and health. Thank you very much. I have been reminded that the women at 40 are here. They have been in the struggle for 40 years. Where are some of their representatives? Women at 40, if you see that banner there, it's them who have made it. You can see some of them on that banner. Thank you very much. Ladies and gentlemen, I'm now going to hand over and invite the chair of the next session, the Honorable Naomi Kabasharira, MP for Rushenyi County in Tungamo District, and then she will be now the one starting to invite the next group. Do we have the performers here? The performers come and usher in our Honorable. Where is the Odong group, the Yoleng team? Are they here? Aha. They are the ones going to usher in Honorable. Then they will, the reason why I want them to usher in Honorable is a special one from the meaning of that song, so that the path is clear for Honorable now to take over. Odong, you're welcome.
Give our MC a mighty hands of applause. Otiening, Otiemabe. Yes, I'm speaking in tongues. If you don't understand, just say bear. Mama, it's really nice to meet you again. Yes, the last time we were in Atiak, that was the last time we met, I think years ago. And thank you, Afoya Bino. Bear, that is Honorable Minister Amelia. She speaks the language very well. If you don't understand anything I'm saying in Acholi, just go to her. Amen. We bring you greetings from heaven. I mean, Guru. That's where I come from. And yes. And I want to thank the organizers for every contribution. It's my responsibility that, yes, I am here to grace the occasion with songs. I'm going to do 2 songs. But as an artist, I would like to also bring to the attention of everybody here that I lost my father in 2013 as a result of HIV. But one of the things that I did for 3 years with him was go and line up in the hospital to collect his ARVs and give to him. But as an artist, it's not an easy thing because people take us differently. It's like our malaria is different. When we come to a place, we are not even supposed to line up for food, like we don't feel hunger. So we go to the hospital, and one thing that happened, that as we are lining up and moving, people are trying to take selfies of themselves and making sure the artist is being seen behind, indirectly trying to say, yes, we are in the same line with the artist. But we are normal human beings, and I think our treatment needs to be taken rather just like any other person, or else there must be an option that should be created especially for people like us who share this kind of platform, so that we can religiously also be part and parcel of eradicating and getting treatment very well. Because it's very hard for artists to align with everybody. People judge us differently. It's the same, even when we tell you now, I want to marry your daughter, you're like, that one, an artist, there's already something about us. So I want to advocate on behalf of the artist that when we come, please, if there's a way things can be handled differently, it will be awesome, so that we have a longer life and continue to contribute to this nation. That's my responsibility. Hallelujah. Amen. We are doing 2 songs because of time. One song says, I'm so UG, I am so Uganda. I just got into the country from Canada 2 nights ago, and I'm glad I am part and parcel of what God is doing here. So everywhere I've been, I have been a Ugandan, at heart and in practice. Amen? Amen. You can rise up on your feet and dance with us. Awabe! More sound. Awabe! Eruba! Cherio de awume kerikume. Follow me. Follow me. Follow me. Everywhere I go, I'm so UG. 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 La kubu kubu, come dance la kubu kubu. 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 Everywhere I go, I'm so UG. Everywhere I go, I'm so UG. Mawe, Bilubana, Kilobuna. Wanam yellow be Uganda. Bilubana, Kilobuna. Wanam yellow be Uganda. This is the part of Africa. This is the heart of Africa. This is the part of Africa. This is the heart of Africa. This is the part of Africa. Make some noise. This is the heart of Africa. You got to well low. You got to well low. Heart of Africa.
Ayo, 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 ayo. Yeah, yeah, yeah. Put your hands together, everybody. Adwala moni gidwala Dubaye kuya Mawe Utero longuna ni gitweya Dubaye kuya Mawe Uwirwa biri ni gitweya Dubaye kuya Gaan Dubaye Make some noise 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 Beitema Awaji gaan Dubaye kwara Beitema Ujoni gaan Uleye kwara Beitema Mawe Kupara nya kweni gidwa penya Dubaye kuya Yikape kumani gidwa penya Dubaye kuya Uwiru matani nera Dubaye kuya Ukiero kwe nera Dubaye kuya Kaan Dubaye kwara Beitema Kaan Uleye kwara Beitema Ayo Put your hands together. Ayo, the matter the pay don't lose hope. The guy when you're down on pay Yoling, no matter where the pay Yoling, the guy when you're on your knee pay Yoling, no Barbara Teroki, yeah, Yoling, wano karakara do. Yoling, you wano karakara do ma. You wano wara do ma. You wano karakara do ma. You wano wara do ma. You wano karakara do ma. Awabe, make some noise. Anira, awabe. Yoling, wara wara yoling, wara Yoling Harapara Karaba.
God bless you.
Wow. Wow. Thank you so much. Let's put our hands together to thank Mr. Dong and the team for this wonderful excitement. You have excited us to the next session. Thank you so much. Thank you so much, Makerere, and our lovely students. We are now starting yet another session, and I'm honored to be the chair of the session. Thank you, Mr. Dongotho and Princess Winnie, for taking us through as MCs. I'm privileged to now bring you the testimony, which is going to be from Michael Senyonga. But before he comes, let me introduce myself. For those who were not in the other tent, my name is Naume Kabashara. I'm not Honorable Jessica Ababiku, who, according to the program, was supposed to lead us, the chairperson of Presidential Affairs. However, by the grace of God, I'm a vice chairperson to Honorable Babiku, and today we had a tight schedule, so we decided to divide ourselves. I came this side to represent her, and then she also does the other work, because we are supposed to present a report today. I represent the people of Rushenyi County in Ntungamo District, and I also serve on that committee. May I also take this opportunity to thank the organizers, the AIDS Commission, for this wonderful setup. It has been raining heavily, but you have managed at least, and I'm happy that today as I come, God answered our prayers and it has not rained. And I pray that we come up to the closing time when it has not rained, and it's not going to rain. So with that, may I now call upon Michael Senyonga to give us the testimony. Michael Senyonga is the one to lead us. You know, these testimonies, they encourage, and how I wish testimonies can even be heard by as many people as possible. For us who are believers, when you give a testimony, then it leads to someone else also to become a believer. So let's listen attentively to Michael. Thank you.
Thank you, Chair. Our dear guest of honor, the honorable members of parliament in the House, the United Nations family, the Uganda AIDS Commission family, the development partners, the Global Fund CCM team, fellow activists, ladies and gentlemen, and the House at large, good afternoon. Come on, good afternoon. You know, gone are the days when we thought a testimony is here to make us cry tears, shed tears. Please don't join our film. We cried our tears, join us in the joy as well. My name is Michael Senyonga, and I come all along from Kcca. I am a young person who was born and living with HIV for now 24 years. Ladies and gentlemen, my father died when I was only 4 years. By then, I was a very young child, and my mother had left. Why did my mother leave? My father and my mother used to fight every single day with our eyes wide open and watching. So my mother would not bear the burden, and she chose to leave. When my father died, of course, he was taking care of us as a single man. And then they asked my grandmother, where are we putting your grandkid? My father died HIV positive, and he didn't adhere to his treatment. So this is the statement my own grandmother said. This kid is dying tomorrow because I had an abominable disease. It was me, my father, and my mother who had it in the entire clan. So my grandmother said I was a curse to the family. Little did she know what God had for me in the future. So I was cast out on the streets. I was chased out of our home. No uncle, no auntie. This is a curse. This child is dying tomorrow. No one wanted to take us on. No one wanted to take me on. The handsome young man you see today in front of you, I grew up on the streets of Kcca for 4 years, and I didn't know my HIV status for all those 4 years. Thank God I did not die on the streets. I was later taken up by a well-wisher, an old woman. Please, let me tell you this. If you have the capacity to take up someone, please take them up. You don't know their future. Please take them up. So I was taken by a well-wisher, and she helped me go into a government school. I went through the UPE school, and I had to put on shoes in P7 after my grandmother, after the headmaster bought me the first pair of shoes in primary 7. I was taken on by PEPFAR CDC OVC program for senior 1 up to senior 6. But guess what? That is a part of education, but a part of health. In my primary level, one of the sons of that well-wisher chose to take me for medication, for an HIV test, because this is a young man picked from the streets who was falling sick time and again. Every single day you're sick. The belly was a pot belly. My skin was as white as snow. The hair, I didn't think I would get good hair. So he chose to take me for treatment, and when they tested me, they told that man, I call him uncle, they told him I was HIV positive. I heard that with my ears, and remember at school, the day before we had just sung HIV is a killer disease. We had just sung that at school. So I knew I'm a gone case. Now that you've said I have HIV, so I'm dead. So I looked at myself and said, Mike, you're dead. Ladies and gentlemen, that man, whom I call my uncle, held his pen, scratched his head, and told me, never tell anyone that you're HIV positive. Instead, he bought me a box of Septrin. Said, please go and start taking this. Never tell anyone. I took medication until I got tired. And eventually I told my guardian, do you know what? I'm HIV positive. So the best she did was to tell the entire community. You look at that street kid I picked, she's HIV positive. That street kid is HIV positive. Thank God among the people she told was a VHT who took me and attached me for treatment at the Mighty Kilembe Mines Hospital. I began my treatment when I'm 9 years old, and it was on the Tuesday of 17th November 2008. Surprisingly, tomorrow I'm making 15 years on treatment, and I'm still healthy. Ladies and gentlemen, I went through school, and I started getting a hope of a better future. I started getting a hope of being a great person in the future. Despite of who I was, despite of the street kid in me, I believed in myself. I still believed in myself. Without parents, I would still make it. Ladies and gentlemen, time came when I was in senior 4. I scored a first grade and was taken on again for sponsorship to senior 6. But during senior 5, here comes the Uganda network of young people living with HIV. It came to Kcca, and they had the Y+ beauty pageant. And my facility selected me to be one of the participants of the Y+ beauty pageant. But me, I didn't know. And so when we asked, they told us we are going to eat rice. And as a boarding gent, I went to eat rice. So I made sure I go with my 3 girlfriends and my friends. So when we were there, of course, it was a question and answer session. I'll never forget the last session where the judge asked me, Michael. After answering all the questions, she said, Michael, are you HIV positive? Just like you're sitting, my girlfriend was in the audience. My 3 girlfriends, actually. Just like you're sitting, my friends were everywhere. Cameras were everywhere like they are now. I shed tears and spoke it out and said, yes, I am. Guess what? I lost my 3 girlfriends that day. None of them came back. But today I have one of the most beautifulest girls who helps me to take my treatment very well. So I emerged the winner of Western Uganda and was brought to Kampala for the first time. I came to Kampala in 2019 for the first time. That's when I crossed the Luera to come to Kampala. That's when I crossed Fort Portal to come to Kampala. And when I was there, I still emerged as the national winner of the country. Ladies and gentlemen, I am not where I want to be, but at least I am no longer where I used to be. Now, I want to take the opportunity to fully introduce to you myself. I'm no longer a street kid, and I'm no longer that young, vulnerable HIV young man. Today, I am the national representative of young people to the Global Fund CCM Board of Uganda. At the Global Fund, we fully influence grants. We look at grants. So I sit and plan for young people. Young people's needs are brought to my attention in the country, and I bring them back to the CCM, and the CCM incorporates them. I have great news that young people's programs are in this grant, the NFM4 grant. We have a lot of young people's interesting programs. Who brings them on board? The street kid from Kcca and that young person living with HIV. Ladies and gentlemen, I am an award winner of the upcoming Philly Lutaya. He's my role model. And I won that award as an upcoming Philly Lutaya. Ladies and gentlemen, I am the director of the Kcca network of young people living with HIV. I mean, I'm no longer that young small boy that you're going to look down on. I am now someone in this country. To the partners, I am of your funds. I am a product of your funds. But I am just one in a million. There are lots of thousands of young people outside there. Lots of young people. And my question today is, my mind says, do we still have the hope? There is another Michael down there on the streets. There is another Michael down there in the ghetto. There is another Michael in the markets who is not even sure of what to eat, who is not even sure of where their future is. There is another Michael who is not even sure of their education. But I have great news that the future still moves on as long as you adhere to your treatment. Who is Michael in the next 50 years? Not even 50, 5 years. I meant 5 years. Who is Michael in the next 5 years? Michael is a great leader in the next 5 years. Michael will be a father of a negative woman. Will be a father of a negative child and a husband to an HIV negative woman. And I will not infect any of them because I'm taking my treatment. Who will be Michael in the next 5 years? Michael will be an inspiration to many other young people living with HIV in this country. And my call to action. I want to thank the Uganda AIDS Commission. Thank you for putting us in place and believing in young people. We assure you your efforts will never die in vain. We have watched you, we have learned from you, and we are growing from you. To our beloved government of the Republic of Uganda, here and outside there are lots of young people with vibrant minds, regardless of their status, regardless of where they were born, regardless of who they are. Let's embrace them. Let's trust them. Let's spread love, and let's take away the hatred. Ladies and gentlemen, other Michaels, and even greater than Michael, can be risen. And for that matter, therefore, I encourage us as we celebrate Philly Bongole Lutaya, let's also remember to celebrate the unsung heroes that are down there in communities. I come from Kcca, and we are doing an amazing job in Kcca. Thank you, and thank you so much.
Wow. Wow, wow, wow. What a wonderful and a moving testimony. May we again clap for Michael. Thank you so much, Michael. Although you did not tell me where, you do not tell us where that old woman who said you are going to die next time, where she is now. Is she still living or not? Yeah, Michael says she's still living. I don't know how she's taking you. Thank you so much. And time is not on our side. Can we now have our good legends who are going to attend? Oh, I can see Joanita. Joanita Kawalia, I'm happy to see you. This Joan is my OG. Yes, we started together. She's my buddy. I'm happy to find you here.
Mama Naume, my OG, but of course Mama, our guest of honor. It is really a very big surprise today. The person who is going to sing Phile's songs, just like I show you there, Phile started singing a very young boy. Then we felt we need to identify a young person in this country who could sing Phile's songs. And he's going to present two. And what is funny, his name is Michael Nteyafa. Nteyafa is a student at Makerere University now doing psychology. But very, very gifted in music. Very, very gifted in music. And he's going to do two of Phile's songs, and later on it would have been myself and Honorable Rachel Magola, but she has just been invited by Honorable Lumumba to go and prepare, because she's in charge of entertainment the other side. So may I please welcome Michael Nteafa to do your 2 songs for the late Phile Bongole Lutaya.
Tulo kwatu mwana woto mukwate ngoli mulogo sewo ulira. Tulo kwatu mwana woto mukwate ngoli musezi sewo ulira. Jagala kendako kumazina nzine kundongo kyuse ku bulamu obulamu bwakuleka. Jagala kendako bweru kanchakaleko luli balumunga lukuye walumbe mutemu tasasira. Tulo kwatu mwana muto mukwate ngoli mulogo sewo ulira. Tulo kwatu mwana muto mukwate ngoli musezi sewo ulira. Jagala kendako kumazina nzine kundongo kwate ku bulamu obulamu bwakuleka. Jagala kendako bweru sanchakaleko luli balumunga lukuye walumbe muzemu tasasira. Bakulu abanzala sibalabanako isa amaso banange betwasoma basasana nafuka momboze nzuno mpoza amawanga kanfube kakasi nemba nfunye ekiseera bana bange mundeke nchakaleko. Mbeera z'abantu zikyuka ng'obudde kwagala olwaleero enkya kukyawa akusekera olwaleero enkya sibasumbusa nakirako eddubu. Tulo kwatu mwana muto mukwate ngoli mulogo sewo ulira. Tulo kwatu mwana muto mukwate ngoli mulogo sewo ulira. Jagala kendako kumazina nzine kundongo kyuse ku bulamu obulamu bwakuleka. Jagala kendako bweru sanchakaleko luli balumunga lukulye walumbe mutemu tasasira. Wenzijukira betwalinawo musikusi we wakawumba mukwano Rafaeli yagenda esira kumwa n'abalala bangi ne bagoberera. Stale leka waliara mutwalae babali bamutae chambade ambulako jese kasilivu bamubuza oyo muyanja simulabako Michael Luzinda bamuta walumbe walumbe banange tasasira walumbe silabarachi anomyayo benjagala leka neyagaleko sasa musango luliba luti lutute enseno teina nyitiyo omugaga n'omwavu fenna tulikwata lumu tulo kwata omwana botomukwati oli mulogo sibuulira tulo kwata omwana botomukwati oli musizi sibuulira jagala gendako ku mazina nzine ku ndongo kyuse ku bulamu obulamu bwakulega jagala gendako bweru kancakaleko luli balunga lukubye walumbe mutemu tasasira
Born in Africa, sing my song, music Africa.
I was born to sing, I feel the music, it's in the soul. I was born to dance, I feel the rhythm, it's in the drum.
Ay, 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 ay. Oh, yo, 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 yo.
Don't worry where you're coming from, so wonderful when people meet. Down in Africa, the land of the sun, we sing and dance, it depends on the mood.
I was born in Africa, sing my song, music Africa.
I was born to sing, I feel the music, it's in the song. I was born to dance, I feel the rhythm, it's in the drum.
Ay, 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 ay. Oh, yo, 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 yo.
Music is the topic today. Let us throw our worries away. No frontiers, no barriers to tread. Just doing what we choose to do.
I was born in Africa, sing my song, music Africa.
I was born to sing, I feel the music, it's in the soul. I was born to dance, I feel the rhythm, it's in the drum.
Ay, 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 ay. Oh, yo, 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 yo.
Oh, the great rich land, rich in history. A black man, a great contributor in all our lives. Oh, those great gunmen, the fathers of our land. It's up to us to keep rolling on. Oh, oh,
Born in Africa, sing my song, music Africa.
I was born to sing. I feel the music, it's in the song. I was born to dance. I feel the rhythm, it's in the drum.
Ay, 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 ay. Oh, yo, 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 yo. Ay, 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 ay.
One message from the land of the sun. Love and peace to all of the world. Ebony and ivory. Side by side, it's you and me.
I was born in Africa. Sing my songs, music Africa.
I was born to sing. I feel the music, it's in the song. I was born to dance. I feel the rhythm, it's in the drums.
Ay, 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 ay.
You gotta sing along.
Ay, 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 ay.
You gotta dance again.
Ay, 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 ay.
I praise motherland.
Ay, 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 ay.
You was born in Africa.
Ay, 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 ay.
Mr. Music Man.
Ay, 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 ay.
You gotta sing along.
Ay, 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 ay.
You gotta dance again.
Ay, 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 ay.
I was born in Africa.
Ay, 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 ay.
Praise the motherland.
Ay, 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 ay.
You gotta dance again.
Ay, 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 ay.
He was born in Africa.
Ay, 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 ay.
Ladies and gentlemen, that is Michael, a young person. Philo was older than him by the time he started singing. And where you actually wanted all the instruments to play. Philo was a gifted person who could play the saxophone, who could play the guitar, who could play the keyboards, who could compose, who could sing. That was Philo. That was Philo. Ladies and gentlemen, I'm one of the legends to remember Philo Bongole Lutaya. But before I sing, I would like to introduce to you the person who actually identified me as an artist in this country. People didn't know me, but Seba Nebanyabo. Omuntu eyanzuula nti ndi muyimbi. Abantu abasinga temumumanyi. Nsaba on this day, mbalaga omuntu eyanzuula nga n'Afrigo temanyi. I've been in Afrigo band for almost 30 years, and I'll be celebrating that big show of mine maybe next year before Afrigo band celebrates the 50 years. I would like to invite Mr. Dipe Katumba. Mr. Dipe Katumba, we used to call him Diplock Segawa Katumba. Please come on stage. Give a gift clap to. What I'd like to say about Philo, Diploc or Dipe. By that time, she used to identify students who had talents in schools. And I was one of the people who was selected. Margaret Nanju Chimukuye. Then there was a certain son of the late Engineer Waligo, Asanasio Waligo, Maria Nachaga, but she's now an engineer. Michael Kadu, he was a son of the late Reverend Kadu, and Mama Joyce Kadu. Mama, you might be knowing Mama Joyce Kadu. So this man here, this great man in my life, managed to identify me. I come from a background. My father was a legend musician by the late of Eli Eklas Kawalia, and his friend, but his brother-in-law, Elishama Wamal, who married my sister Rebecca, and sang Akana Kakawalia Kawanyana. So, when you look at a person who was there to identify young people who have talent, where we are going in skilling now, and we are having a gap of now young artists to identify what should they sing. They are singing Kola Taxi. These people actually help us to mentor us of what we are singing now. If I sing a song, you'll see it's a song. We thank you, Diploc, to make us great people. Thank you. I'm going to sing a song called Jim. It emphasizes faithfulness, abstinence, and avoidance of domestic violence at home. And whoever knows the song, make sure you sing along with us. Thank you. Ladies and gentlemen, we always call this song a special song to all ladies. And I do dedicate this song to all the ladies in the house. Enjoy. Are you ready to sing with me? And dance at the same time. Mama Mary, you are going to dance with me. Obulungi bwose bu Jimu wange Buzije waffe Nze Jeni sikyaddayo Olwaleero kankubulire Ekyama kyange Gwe gundasiima Ndakuumanga obulamu bwange Bonna abaali bakwesunga Bambi aboze mbasasidde Ebibyo balumbule Tebandaba nti nze gwekutte Seka kumwatu Kukaseko kange Ebibyo bye byange Wenaze kweyagalira Awo Kyekyo Yebyo Era yenze Ready to sing with us? Women, where are you? Abachara, you people come. Come, just come. Tukole tutya okubeera omu tusonyiwagane nga mu nsobi zaffe tusabenga nnyo Katonda waffe olugambo
omutwa olole walenga emikono gipime kinatuyamba esente bukisa zijja ne ziddayo kuba kukube obwo si bufumbo awo kyekyo yebyo era yeze
Tokuba
ndi mwana wa bantu jukira gye wanzija toyombanga bantu kumba ekitiibwa kyo wekanya bwokka n'amazima bye noonya nze ndaba byebyo tukuuma obufumbo bwaffe jiba olowooza otya
ku maka gaffe
tukole tutya
okubeera omwo
tusonyiwagane
namusobi zaffe
tusabenga nnyo
katonda waffe
olugambo omutwa
olwo lwewalenga
emikwano gipime
kinatuyamba
esente mukisa
zijja ne ziddayo
nkuba kukube
obwo si bufumbo
ameri yanzewuwo
azo
ameri yanzewuwo
yezo ewo
ameri yanzewuwo
yezo awo yezo
ameri yanzewuwo
yezo awo yezo yezo awo yezo yezo awo yezo yezo
Why don't we give her a standing ovation? Yes. Thank you so much, Joanne. Thank you. That's her. She was even very good at fine art in Nabingo. Yeah, that's her. This is very, very entertaining. I always say that these musicians, I have some question marks to some of them. These days when you go to functions and people pay a lot of money and bring in them, there's even a fashion of bringing bands. But I've always asked that, why don't they be like this band of the Joans, which sing their own songs, rather than imitating someone's song. I don't know, Joan, you need to train these other bands so that they stop copying. They copy and paste. But thank you so much for that. Good. And also these other, the young man who is coming up, I think you will learn how to create your own songs so that you make a good musician. Since we have the Katumbas here, you need to bring up this and you teach them. Don't you see Joan? Aren't you proud of her? So we need also to handle others. Okay, now with that, allow me to bring you someone important by the names of Honorable Chambade Amelia, who has come to bless this good meeting. Honorable Chambade is was one of the longest serving PPS. PPS is a very important person to the president. I think so far nobody has gone beyond the years that you served. That man is not easy to serve for all those years, but you managed. We thank you. From there, she decided to join politics, and she became a member of Mawokota constituency. The president identified her, and she was appointed the minister, and she served very well. By the time she left politics, she was a minister for trade and industry. And during her time, you very well know that it really performed very, very well. And right now, she's a senior presidential advisor, and she's here in her capacity today representing the Minister for Presidency, Honorable Bide Babalanda. Honorable Babalanda is the minister who takes care of AIDS Commission. So it's not by mistake that we get Honorable Amelia Chambade, who will give us some institutional memory of Fire Bongore Rutaya in fighting this HIV/AIDS, because by the time Fire Rutaya even came and died, they happened to live, I think, in Sweden at that same time when Maria Chambade was also, you know, we have people who fought for this country with the gun and without the gun. So she's also one of them, and I think that was the time Fire Bongore Rutaya was there. So she's not by mistake that AIDS Commission chose her to give us this keynote address. And I also would like to tell you that Fire Bongore Rutaya, when he came to Uganda, the first time, that was the time I was at the university. And you know, when we were young, like you hear them shout, that's how we also shouted. And for us, we were shouting, Katulimba, Kagala Sente, Kaze Kulia Sente. I hope you know what it means. Because we thought there is no one who could come up openly to say that he's HIV/AIDS positive. By then, there was a lot of stigma. So he's actually, Fire Bongore Rutaya is a hero. He's a hero for this country. Therefore, can I now, you people, call you to put your hands together to call upon this Honorable Chambade to give us
Hello, hello, hello. hello, hello. Oh, what a day. Oh. I just want to thank, before I address everybody, I just want to thank Wanyana for taking us back. We used to call her Wanyana, sorry. For taking us back to the good old days. Thank you so much for involving me. So the chair today, honorable members of parliament present here, board chairman and entire management of Uganda AIDS Commission, Chair Dr. Nelson Musoba, representatives of the family of Phile Bongole, but they didn't introduce them. They didn't introduce the members of the family. Oh, they're online. I salute them. Representatives of government ministries, departments, and agencies, our development partners, the constituents of people living with HIV, the youth leaders from different institutions. I recognize Makerere, I recognize MOOBS, I think there are also others. All stakeholders, members of the army here, represented by the great people in uniform. People living with disabilities, represented by Dr. Nkwangu. Our musicians who have actually led this function and brightened it up and put life in it. All protocol observed. Amelia Chambard have been introduced here. I'm currently actually in the private sector as well. I do domestic tourism on Mitiana Road. I am a senior presidential advisor, but I'm also a member of the board of Fresh Handling Limited. It deals with selling fresh fruit and flowers. And I'm a citizen of the Republic of Uganda. All the other issues have been introduced. I need not go into there. I was delegated by our minister, because I'm under the office of the president, so it's the minister in charge of the presidency, but also responsible for AIDS, to represent her. But what I'm going to present here is a hybrid of the speech. Her part, I couldn't resist the temptation of inserting my part. So I'm not going to mutilate it, but I'm going to put a bit of life in it. Well, I do salute Uganda AIDS Commission, now under the leadership of Dr. Nelson Musoba, for being consistent and active in coordinating all HIV/AIDS activities in the country since 1992. As we commemorate the life and legacy of Phile Bongole Taya as one of the icons of HIV/AIDS, let us also celebrate all our fallen citizens, especially those who openly declared their status to save our lives. We should not forget the ones who are still alive, like retired Major Rubaramira, Ruranga, Reverend Byamgisha, and others who were courageous enough to come out and declare their status publicly. Let us give them a big clap in absentia. We cannot talk about people and not talk and leave out structures. So I would like to commend the structures that were conceived and that supported Phile Bongole's courageous awareness message, not only nationally, but also globally. Allow me to thank His Excellency President Yoweri Kaguta Museveni for his exemplary leadership in the fight against HIV, AIDS in Uganda. His decisive approach towards this scourge in 1986 is highly commendable, prioritizing HIV as an enemy to the people, and through his visionary leadership, the country has witnessed a steady decline in HIV-related mortality across all ages. The entire world acknowledges that His Excellency Yoweri Kaguta Museveni is a great leader in fighting pandemics, for example, HIV, Ebola, and recently, COVID-19. As an institutional memory of working with the president, I recall that there are fundamental structures that were conceived to support the president's campaign in the fight against HIV, but also to fall in line with Philip Bongole's legacy. Uganda AIDS Commission was the key institution at the forefront of this fight. And it was under the president's office, with His Excellency as the chairman. He advocated for a multi-sectoral approach under Uganda AIDS Commission, which included stakeholders like gender, finance, judiciary, and many others came on board because they also had a role to play. The inception of Uganda AIDS Commission was a success story, as other countries like Kenya, South Africa, and other West African countries came on board after a lot of resistance, because in the beginning they thought we were going to kill our tourism industry. But they came on board and also established those commissions in their respective countries. Globally, the United Nations AIDS Program was also established in 1994 with the same concept as Uganda AIDS Commission. And I recall, because I was working as a PPS, I recall they came for benchmarking. And they established UNAIDS. So, however, due to the anonymity of the mysterious disease, the president recommended that a JCRC Joint Clinical Research Center is established to do research into that disease, because nobody had any idea about it globally. So JCRC was established, and the first fund I remember, the grant, was from World Bank, and it was USD $150 million. I remember all that. I would like at this juncture, and I feel it's important because sometimes we don't know these facts, that we salute His Royal Highness Kabaka Ronald Muwenda Mutebi, who offered the Butikiro, a structure which was meant to be for the Kcca. He offered it for free to accommodate JCRC for 20 years. So he also had a vision in that. But you don't mention these issues because we don't know and because we don't share the facts. But I am aware, because I remember Dr. Ben Mbonyi and Colonel Andrew Taya went and met the Kabaka, who willingly offered the premises and said, you can use it to save our people's lives. I wanted to bring out some of these facts, that when we are celebrating some people, we should remember also to appreciate and applaud other players in this journey, because it was not a lonely journey. JCRC was initially chaired by Dr. Jessica Jimba, who was the president's doctor. The Germans were very instrumental, and I remember Professor Dietrich, who came and were the ones who started JCRC. They brought machinery, they trained our people, they took our people to be trained. They actually started treating some of the people who were taking our people to Germany for tests. Then there was Jagdish, there was Dr. Ziegler, then there was Dr. Peter Mjenyi. And currently, there is Dr. Sisi Chitio. So what was the main objective of JCRC? It was to carry out research on the viral content of HIV, the drugs that could help it, and other related diseases. And indeed, Ugandans have benefited from this. I'm proud to inform you that JCRC now has broadened its scope in research. They're researching into bone marrow because now HIV is not as serious, at least it is manageable now. It's not as serious as it was at that time. But you should not relax. So they're doing research on bone marrow, stem cells treatment, and non-communicable diseases. These non-communicable diseases are caused by you, the way you eat, the way you drink. Then you get hypertension, diabetes, all these. These are the non-communicable diseases. So JCRC now is doing tests into that to find out how we can cure them, how we can stop them, and what type of drugs do we need. A clap for that. So they celebrated 30 years recently, and they have a home of its own. But all these are initiatives of the president, and we salute him. But when I mention president, you don't clap. Why? So globally, development partners have supported our journey, and we thank them for that. The Americans came on board, all the UN units came on board, Germans, British, Swedish, our development partners came on board, and up to date, they are still with us. We thank you. Through Americans, through PEPFAR. So the journey has actually broadened its scope to actually cover other areas, but also to include other partners. We thank them for that. But most of all, I would like to thank Ugandans, because we thank everybody, but we forget to thank ourselves. Why? Because we have responded positively to the call. Let's give a clap to ourselves. We go for tests, we abstain. I don't know, I think someone is laughing out there, but I think you are trying. We go for tests, we abstain, we at least have responded to the call and to the fight. If it wasn't for you, all this would not have yielded any results. I thank you for that. So the reason for our convention today, let me get back to the point, is to celebrate Philae Lutaya as a legend. We were living in diaspora with Philae. For us, we were living in Gothenburg. We had fled the country. We were living in diaspora. For them, they were living in Stockholm. So Philae was our source of entertainment. We would come from all over. Imagine we're refugees who didn't have enough money. But when you knew that there was a show that Philae was going to entertain people, or there was a Uganda forum or anything like that, all of us would board the train and go, at least to dance throughout the night and enjoy. But we admired Philae. What my sister is saying here, we admired his talent. Because he could sing, he could play all these instruments, and we used to wonder how. He was an idol. He was a celebrant. I have not seen anybody like that in the music industry. Nobody. Nobody has that capacity anymore. It is gone and gone with Philae. So we just used to go and stand. People would dance the whole night. People would just sit there and look at this young man, young talented man. Humble, polite, smart. You know, he was everything. He was an all-rounder, I would say. communicator. He knew how to communicate with everybody. So in the late 80s, Philly started absenting himself, staying in his flat, not coming out, not socializing. Sometimes there would be shows, he wouldn't turn up, and it was unlike him. He was an extrovert, but he became an introvert. And it took time for Philly to share with people. But whoever accessed him could see that he was changing. His color had changed. He was losing so much weight. He was no longer communicating. And you know, because he was our celebrity, word was going round throughout Sweden that, you know, he was going through that. But we all didn't know what it was. So they started taking him to some of these Swedish hospitals and research centers. But some of them thought, the Swedes thought maybe it was one of these African diseases. Little did they know that it was going to go global. They started doing tests, and eventually they found out that he had this rare disease, because it was new, completely new. He had this rare disease, and of course, it was like he was dying any time. Of course, they detected it quite late. He had had it for some time. Maybe if they had detected it early, maybe if the medicine was there, we would still be with Philly today. But we were all so sad because Philly is one person who would remind us about Uganda. You know, in the diaspora, you're so lonely. You want someone to remind you about home. Africa, and other Africans just admired him. I was listening to Born in Africa, and I had so much nostalgia about him, about those days. Because all Africans loved him for that. He reminded them, all of them were living in diaspora. You know, in diaspora, it's not so easy. We suffer. You people, you do not know how living in diaspora is. I can write a book about it. It's terrible. Knowing that you don't know when you ever go back to your country, it's not easy. So our comfort and solace was Philly. And whenever there was a show, that is why the hall would fill up, because people wanted to remember home. People had that nostalgia about home. And he would give us that comfort. It is so sad that he's lying in his grave now. It is so sad. And when he told me to come and speak, I said, I have never shared all this. But I'm glad that I've been given an opportunity to share this. But you know, it takes courage. I told you, Philly was a celebrant, a young man we all looked up to. For him to come out and say, I am sick, I have HIV, we have cause to celebrate that. You ask yourself, in fact, I admire even all these Michael Sentongo and all, but because they know someone has done it. This is where the courage is coming from. But if nobody had done it, would anybody come out? No. So for him, as a young man, smart, adorable, for him to come out and confess publicly, it is a gift. And it's a rare virtue, very rare. Not many people can do that. We live in denial all the time. We live in denial. We never tell the truth. But he did. That shows the courage, the selflessness, the empathy, the nationalism, the Pan-Africanism. In Philly Bongole Lutaya, let us clap for him. If it was somebody else, someone would have said, no, let me die in Sweden. Bury me here. don't tell anybody. That is what people would have said if it was. But he did not do that. He came back and he continued with the academia, with the public servants, Philo would talk about HIV. And even when he had become very weak, he would still go, they would drag him to the shores. He would try to sing, and you could see his voice was going, but he was committed and said, let me die with that message. How many people can do that? They would carry him. I remember sometimes they would bring to Afrigo, but you could see his whole body was just wounds. But Philo sacrificed. And up to the last minute, until he could walk no more, Philo sang until he died. For you Ugandan, to live, to lead a better life, to save you, to save all of us who are seated here. And I want to thank all of you for having come to be here and witness and share in this cause. But most of all, I want to thank Uganda AIDS Commission for having come up with this vision of remembering a legend where most people would have said, it doesn't matter, after all, he was a musician. I would like to thank Uganda AIDS Commission for including the youth in this struggle. Because I remember in the first few years, we didn't think much about the youth. What I mean to say, the struggle was all revolving only about technical people, doctors, only doctors. But now the youth are also spreading the message. Please continue spreading it to all the institutions because we need you alive. I want to thank this band also for spreading that message because it goes out more if it is composed in a song or if it is played as in music. So although he died 34 years ago, his messages and teachings still live with us today. And I hope the message will live on with our children, grandchildren, so that, because we don't think that HIV is going to stop here. You never know. So we want to thank him for that, wherever he is, and his family. So what is the success and work done by Philo Bongole Rutaya in the HIV arena? This is the message from the minister in charge of the presidency. Now I begin from here. I've already narrated my experience. So let me talk about Madam's message. Honorable Minister says that Philo Rutaya was an activist, that he sensitized Ugandans about the HIV scourge as he moved in schools, churches, communities, workplaces. And we all learned a lot from his messages. And eventually, his message impacted the whole world, globally, Africa and the world. She goes on to say that the selfless effort Philo Bongole put towards averting the HIV scourge would qualify him as a patriot. And I've already said, a Pan-Africanist. He led by example. How many people of you are ready to lead by example? There are very few. He spread the word about HIV. So this is a call for you to continue educating and sensitizing others. So Honorable Minister goes on to say that what the country is doing is to re-echo the deeds of Philo Rutaya in the fight against the HIV scourge. Currently, about 1.4 million people in Uganda are living with HIV. About 52,000 are new HIV infections. And mark you, these are not very old people, they're young people. So I'd like to call upon the young people, especially the young girls. Whom are you relating with? You know, some of these older men, you think you want money from them, but they're also giving you poison. You think you are ripping him off, he's also ripping you off. So please be mindful about that. And there are also other people who have this attitude. After all, I have it. Let me also spread it. How did I get it? They're also there. People who are selfish. Then you go into relationships and they're good. And you young men, you go with these beautiful girls. They're so beautiful, you can't resist them. And you even forget to protect yourself. Please carry your condom everywhere. You never know by accident. You might get excited. You know, this excitement is not timely. Especially if you consume a bit of alcohol. You get a bit dizzy, then this girl who was moving in front of you becomes like a queen. She becomes very beautiful. You start smiling and throwing in words, and where do you end up? But do you know her? Do you know her status? And those very few minutes of enjoyment, how many minutes? I don't know, it depends. Those very few minutes of enjoyment will ruin your life forever. So please, be mindful. You are here, you are shouting, you are happy, you're excited, but please protect your youth. Your youth. You are youth, and you are bound to make mistakes. And it is you alone who can protect yourself. Even if I say so many words, of course, you would walk out there and say, chibadde chigamba chi, byakaddiwa dde. Tebimanyi life. So please, take care of your life. So she goes on to say that, fellow countrymen and women, the fundamental strategies of ABC approach, as preached by the president, should still be relevant. I know some of you are laughing. Abstinence. What was B? Be faithful. C, condom. Some of them sound a bit outdated, but you can improve on them. You can find a way of improving on them. Those, I think, were our era, but you can improve on them. So you should continue with that behavior. But of course, the safest is the condom. And I would pray that you have it wherever you are. So if Philip Bongole had access to ARVs, he would probably be alive with us today. So let us carry on his legacy of embracing testing so that many lives are saved. Allow me to talk about the recommendations that the minister has pointed out. She says, let us focus on research, further research, to find the HIV cure. She goes on to say that she knows that there's work being done by Ugandans. I've noted that there are some Ugandan scientists here. Please continue doing your research. Once we get the cure, then we will have reliable medicine to treat our people and end AIDS by 2030 or beyond. Secondly, she says, let us intensify the behavioral change messages and interventions to the community. The signposts now are a bit few. I remember at one time you'd find signposts everywhere, in the toilets, in the corridors, but now you can see they're a bit few. I think we need to intensify that and put up those messages, and especially in institutions of learning. Parenting culture, she says, is key and critical. If you have to end HIV infections among the young people, we should find time and talk to our children. You as parents, how many times do you talk to your children about HIV? about any sexual activities. We shy away. We always say, Senga, come and help. Come and talk to my daughter. But Senga has her children also. She doesn't have all that time to be with you all the time. So you parents also take a special interest. Let the men take on the the boys. The fathers take on the boys. The mothers take on the girls. But we kind of shy away from them. I don't know why. I don't know whether it's cultural or what. Then guidance. All of you are leaders wherever you are, in your institutions, even in your home. So what guidance are you giving to the people around you, the people you lead? Some are local leaders, chairpersons. Some are leaders of institutions. What messages are you giving out? Resources for HIV response are key. Let us continue lobbying. But you as a person, what have you done? In my case, when I was a member of parliament, I personally built an HIV center. I remember these HIV patients never had transport to go to hospitals. And because of the stigma, most of them would say, bajakundaba. I will not go. They will see me, people will talk about me. So I realized that is the HIV I built in Muduma, on Mitiana Road, and the attendance increased. They had a list of only 280, but after about a year, they became 2,900 who were coming or who were, because they knew they had a home. They have a home, and it is still their home. They go every month to take medicine, counseling, and all that. I put up other institutions. I gave them an ambulance because you could see some severe cases. That is in PG. In Mawatan North, I gave them an ambulance to help them, ferry them to areas. If they want to go to Mitiana or if they want to go to Kampala, at least that would be helpful. I set up clinics for them. So I'm asking you, I'm challenging you. You as you, what are you doing for this? Even your word of mouth, even sharing. You know, sometimes you see this locally sharing that God is coming, Jesus is coming back. At least for them, they have not seen. At least Jesus has not told them. But for you, you know. You have witness. You know people around you. At least spread the gospel. Can you spread the gospel to other people? Or whatever you can afford. That is why I want to thank the band, that they're spreading the gospel through music. So you check yourself, go in your bed tonight and ask yourself, in this journey, this war, what am I doing? What role am I playing as a person? So before I conclude, I want to extend my gratitude to the family of Philip Taya for carrying forward their father's legacy. I want to thank the friends, like my daughter here, my sister Wanyana, for carrying on the message, the gospel of Philip Taya up to today, so many years down the road. I want to thank the officials of different organizations, the scientists, Uganda AIDS Commission, JCRC, PEPFAR, the developing partners, all of them, for the role they've played in ensuring that they save more lives amongst other people. I want to thank Uganda AIDS Commission for bringing the disabled cluster on board, because these are people we never cared about. We thought that they would care for themselves, but I'm glad that that provision now is there, and they are part of the war. And I want to thank Dr. Robert for that contribution and the sensitization he gave us. He told us, do you know who a disabled person is, disability is? And most people are just looking at him. Because if someone told you to explain, you wouldn't explain details. But he told us, and we thank him for that. So allow me to conclude. I've thanked the stakeholders. I've thanked the chairperson. I'd like to thank the people who are living with HIV. Because of your regular attendance, for counseling, for taking medicine. And you can see there is an improvement in the kind of service you're getting. But in the rural communities, there are still some challenges. There are still some challenges. I think I'll talk to some people because the medicine doesn't come on time. There are still some challenges. Although, even though I'm no longer an MP in my area, I know because I'm interested in the health sector, I still go there to see what they are doing. Of course, they don't listen to you very much now, but I still assert myself somehow. And my concern is mainly maternal health and HIV. So I want to thank you all, first of all, for having me. But I want to assure you that HIV is not a death sentence, not at all. You carry on with whatever you're doing. And once we join hands, we are going to fight this and make sure that we all live together in happiness, but also we live together in ensuring that we educate others and fight to ensure that we reduce on the prevalence rate amongst others. So we are celebrating the legacy of Philip Bongole Lutaya, and I'm glad that I've been able to witness it, but also to be able to tell my story. May his soul rest in peace. I thank you all for having me. I say all this for God and my country, and I salute all of you. Thank you.
Thank you so much. Can we put our hands together and we thank for this wonderful statement that you have given us, especially the history. While I'm holding you there, we would like to take a memorial photograph. So I don't know which people should invite so that we also can you?
Honorable Naomi, I request that you also join the photograph. The representative of USC are there. May I invite Professor Nam also to join? There is Charles Emma, a board member representing the youth. Where is he? Charles Emma, I saw him around. Charles Emma is a board member representing the youth. He's not around here. Okay. Young PLH Network. Young PLH Network. Someone come and go and join the team. I think that's okay. Someone from Tasso, kindly join. Someone from Tasso. Okay, AIDS Information Center, kindly join. Do we have Dr. Watiti around? Dr. Watiti has moved out. Okay. Okay, Makerere University. Okay, let's have, now just go behind and join. Now, if that be the case, Makerere University join, and then may I get someone from Nakawa, someone from Chambogo, someone from Gulu, someone from... Just go behind because you have overspread. The camera lenses are limited. The people who are just joining, go behind the guests. The UNSA representative, kindly go and join the camera lineup. The UNSA representative. Students, those who have just joined, go behind. You would rather go behind so that you fit in the lens. Eh? Otherwise, the camera may cut you off. I think that's enough. That's enough. We need to... I'm handing over back to the chair to move to the next item. My instruction is that we should be getting out of here in the next 30 minutes. Thank you, Honorable Naomi. The microphone back to you. What is going on right now is a symbolic signing of the poster for the legend himself, Philip Bongole Lutaya. We have had a signing by Honorable Kabasharira, Honorable Amelia, the chair of the board, and Professor, the member of the board. We will have Dr. Vincent on behalf of USC. May we have also the different student representatives, TASO, the different student representatives kindly come and sign. Nakawa, Chambogo, Gulu, Mbarara here, Makerere. Let them all sign.
A representative from Napofanu, the National PLHIV Forum, kindly come and sign. And then AIC, MADME, and TASO, and any youth-led organization, kindly come and sign. One person representing. Community representative, we have Madam Robina, and then someone from UPDF or police should also come and sign. Let's try to hurry. We also have the Women at 40 memory book, so we would invite you to come and write. If you have someone, a loved one that died of AIDS, you can also write their name just behind the pictorial booth. Okay. So members, please, we are going to continue with our program. We want to, the writing will occur after our next session. You can sign. Yes, yeah, no, please.
Thank you so much. I think you will continue signing even after the speeches are done.
Thank you very much. Ladies and gentlemen, let's give Honorable Amelia and Honorable Kabasharra a mighty hand clap to thank them for the wonderful exercises, and Honorable Kabasharra for chairing so well. She's the one who is going to close our symposium officially. Allow me now hand over to the next chair, Dr. Eddie, the chairman of the USC board, to lead us through the next few minutes as Honorable Kabasharra prepares to close the symposium. Dr. Eddie, you're most welcome.
Thank you very much, Master of Ceremony. You've been seated for long. Can we all stand? I want you to warm your hands, so that we point them to where they are deserving. First Honorable Chambade, let's give her a warm clap. Another one. There's no way we could have had that institutional memory. And I think now the USC, you know whom to invite to give those institutional memory talks. And I hope she will be available and accept. Now, before I leave her, first of all, I want to hand over a gift from Yambala. People from Yambala, come and tassel. Please. Okay. Yeah. And they have an umbrella for you. Thank you so much.
Yes, Yambala for me, supported by Tassel. It's based on 4 components: Yambala condom, Yambala helmet, Yambala seatbelt, Yambala mask. The chairman, we have your umbrella. Thank you.
I hope you are still standing. Another, warm your hands again, warm your hands. We must give the Honorable Member of Parliament, who is a member of our HIV/AIDS Committee, Honorable Member of Parliament for Rushenyi constituency, who agreed to chair the session we've just ended, and she chaired it very ably. Please warm the hands. That's wonderful. You know, when you get these dignitaries on your function, first of all, it's a blessing. Don't you agree with me? It's a blessing. Many of you, I'm sure, didn't know the institutional memory. Now you know where HIV started and how we've got this far, and progress that government has done. But before I take my seat again and chair, let's give another warm, befitting handshake for His Excellency the President. I'm sure they will be able to extend our regards to His Excellency the President, appreciation for the effort that has made us reach this far. And I think people of Uganda will always be grateful because now we are seeing the HIV/AIDS deaths coming down, the new instances coming down, new drugs and innovation being worked on. So sooner than later, we shall see a cure. They're talking of gene therapy, they're talking of the stem cell, and GSRC. I think we have hope. So let's continue working together and facing the challenge together. Thank you. I would like on that note to invite Dr. Vincent Bagambe, who is the Acting Director General, Uganda AIDS Commission, to give a presentation of the AIDS memoir, which is an outcome of this joint review mission.
I am so happy and excited that we are coming to the close of this very important and, in my opinion, exciting event. The Honorable Member of Parliament, who actually doubles also as the Vice Chairperson of the Presidential Affairs Committee of Parliament. Our keynote speaker, very exciting, Honorable Amelia Chambade, who has held so many portfolios in this country and played her part, but also shared with us that history, her history with the Fide Bongo Retire, in exile. Honorable members of Parliament present, the chair and members of the Uganda AIDS Commission Board, all our implementing partners, the funders as well as the people on the ground providing the services, representatives of young people, including our friends from Makerere University, who actually represented the very vulnerable groups that we are focusing on as we cross the tap to new HIV infections, representatives of the other very important vulnerable groups, people with disabilities, the people living with HIV and AIDS. Ladies and gentlemen, in the interest of time, I will not be able to recognize everybody. So on behalf of Uganda AIDS Commission, I thank you that you found time to come and share, not only with us, but also with the general public about what's happening in regard to the fight against HIV and AIDS. I will summarize the undertakings because we have an 80-page joint AIDS report. We have had exciting presentations and poster presentations. We had the exciting exhibitions, and all those contribute to the undertakings that we have agreed to prioritize in the year 2023-2024. So when we come at the end of the year, at the next JAR, we'll be evaluating how much of this we've been able to achieve. So the undertakings are many. I've picked one key one per objective. Under strengthening primary prevention, we have resolved that we will scale up social behavior change communication. This Time Up campaign will be expanded to all districts in the country. And we think that by doing that, or in order for us to do that, we need a refined campaign that not only focuses on HIV and AIDS, but also covers non-communicable diseases, covers pre-exposure prophylaxis for the people at risk, covers condom programming. You heard the keynote speaker emphasizing the importance of condom, and these need to be rolled out across the entire country. And the institutions taking lead in this will be Ministry of Health, Uganda AIDS Commission, and the AIDS development partners. But also to roll out, we saw in this meeting that the long-acting pre-exposure treatment or protection with the injectable Kcca and the vaginal ring are now ready for rolling out. So we have committed that in this year, we will scale this up so that it reaches all the at-risk populations. We are looking at also how to fast-track the 95-95-95. We noted that we are leaving behind the adolescents and the young children, and in order to reach this, we have said that we need to undertake strengthening of targeted HIV testing services to find the undiagnosed positives and link them to effective optimized treatment. And we think that if we do this, we should be able to close the gap and reach the 95-95-95. Again, the institution to take lead is Ministry of Health, Ministry of Local Governments, and the civil society organizations. We will continue to scale up the differentiated service delivery models to ensure that all the clients are receiving the services that are appropriate or convenient for them. And therefore, interventions like YAPS program will be expanded. It is right now in 80 districts, and we think that by the time we come back here next year, we will have covered all the districts. We have also agreed to strengthen integration of HIV services, to also cover non-communicable diseases, to also cover TB, mental health, nutrition, and other diseases that have been reported in this meeting to be the cause of most of the deaths that we see. And objective 3, regarding elimination of mother-to-child transmission, we noted that there are mothers who are not on treatment and therefore they are transmitting HIV to their babies, but also the biggest contribution to that are mothers who get HIV infected when they are already pregnant or breastfeeding. So to address this gap, we have undertaken to scale up the Global Alliance recommendation, which is accelerating progress in pediatric and prevention of mother-to-child transmission activities. We'll do this across the country. And we think that if we can scale up operating where are the gaps in this country. We will do this as Uganda AIDS Commission together with the UNASO. The last area, and colleagues, we have 4 pages of the undertakings, but I've picked just a few in the interest of time. The last area is addressing structural and behavioral barriers. Here we will think that the adolescent girls and young women enhancement programs are doing a good piece of work, but the coverage is still low. So we have committed to expand coverage of these services from the 44 districts that it is in now to the 72 high burden districts.
and have 100% coverage in those. This will be led by Ministry of Health, as well as the implementing partners and the 72 districts that have been selected. We will also build capacity on HIV reporting, especially in the media. We think that these messages need to reach the young people using all platforms, especially the social media platforms that the young people are using. So we want to build the capacity to make sure that we are taking advantage of these new developments to be able to reach the young people with the messages. And we are also looking at strengthening collaborations with the cultural and religious institutions. We have already built collaborations with the Buganda Kingdom and the Kingdom of Toro, which for all their cultural events, they have been implementing, including HIV messaging. We now, in this year, will be looking at including all the other cultural institutions across the country to make sure that they support mobilization for HIV services. We shall be updating the undertakings and sharing with you, all the stakeholders, and once we have agreed on that, this is what will be guiding our implementation, and we'll be expecting you on a quarterly basis to share your contribution to these undertakings as we conclude them. Thank you, Chair, very much for this opportunity, and colleagues, I thank you for God and my country.
Thank you very much, Acting Director General, Uganda AIDS Commission. At this moment, I would like to invite the Young Positive Association for the youth to come and make a brief statement. Young positive people living HIV. As they come, let me take this opportunity to recognize the team from Ministry of Local Government. Can they stand up for recognition? Local Government, a team from Ministry of Justice and Constitutional Affairs, the Uganda Defense Forces, can you stand up for recognition? We had Uganda Police, are they still around? Directorate of Ethics and Integrity, can you stand up? UNSA President, and our board Commissioner Charles Emma, board member representing the youth on USC board. Are the youth available, young people living with HIV? If they are not available, let's get a statement from development partners. Are they? But we had them on Monday. We had them on Monday. I think so. No, those are Peace Corps. If there are no, if these members are not there, it is my humble, my humble, are they, is the youth around? People living with HIV? Oh, was sufficient, okay. On that note, therefore, let me thank Uganda AIDS Commission management, staff, and the board for the work they have done to make this a very successful event. And of course, all stakeholders, service providers, implementing partners, ministries, departments, and agencies that have participated actively. I would like to use this opportunity to call on the Honorable Member of Parliament, Naomi Kabashirira, MP, Kashenyi constituency, to give the closing remarks and close this session. Thank you very much.
Thank you so much, Chairman. I think because of time, you allow me to observe the protocol and we go to the closing remarks. I must say that I am greatly honored to be part of this symposium, but also to be selected to give you the closing remarks. I am happy for all the presentations because I've seen in the program, everything was indicated. And those who came the first day, second day, and today, I believe you have all benefited. Therefore, for that matter, can we clap for AIDS Commission to have arranged all this? How I wish it was for everyone in this country to be part of this symposium, because the topics were very enriching, and then also to benefit from what I've seen, the last presentations from the people with disability, the presentation that was done by PEPFAR, and then this last very one from our keynote speaker, Honorable Chambade. He has given us the good history of our hero, Fide Bongore Rutaya. Thank you so much. AIDS Commission is one of the entities that we appropriate funds for. There are many, and because Presidential Affairs Committee takes so many entities, we take the presidency. In the presidency, there is Honorable Babalanda, whom Honorable Chambade has represented. And under that, now we have AIDS Commission, but we also have security, that is ISO and ESO. Then we also have Prime Minister, the Vice President, then the Prime Minister, and all the ministers under, and then State House, where the President is, and also the recent one, which is Science and Technology and Innovation. And I'm happy that all that I've mentioned, this symposium touched on many of them. But to mention is that AIDS Commission is one of the entities that performs very well in the money that we appropriate to them. So thank you so much, AIDS Commission, and your coordination for this HIV/AIDS. At least we have reached a point where people are now very much aware that AIDS exists. But also it has had a negative side, that everyone has relaxed, that because you can live with HIV for so many years and you don't die. Like at first when you saw Fide Bongore Rutaya, the first time we saw him, we could not believe because there was a stigma. Nobody could believe that one can come here and say, "Me, I have HIV/AIDS." We thought he was lying to get money, and yet he was really giving us the information. But today, and that's why we really have to thank Philip Bongere Lutaya, who opened up the curtain. And up to today, we are now aware that the negative side is that people live, and some people go carelessly, that because nobody dies, no longer die of HIV/AIDS. I'm sure you have, if you don't live also like that, but you have someone who have been like that. In my other representation, I get many cases of the people who come to me, especially those who live discordantly. The wife is either positive and then the husband is negative, or the other way around. It is mostly the vulnerable, the women, who have suffered. Right now, I'm trying to do counseling to a certain couple. The husband learned that he's positive and the wife is negative. So he's been trying to find a way of killing the wife. So that, you know, this kind of thing that, why should I die and leave her for others? So some people still have that in mind. So AIDS Commission, with these agencies that are dealing in HIV/AIDS, we need to continue to give the awareness, the sensitization, because much as people are aware that AIDS lives, but there are those who live in a negative way, not living negatively, but in a negative way of how they perceive the HIV. Then also, we still have a problem, because I'm now talking out of experience, we still have a problem of the people who are taking ARVs in the third line. When we were in the other tent, I called one of them to know, this is the guy I gave you people and you have been helping, but he's still having a problem, a challenge of having to travel from Ntungamo to get those ARVs of the third line from Kampala. I don't know why it is not possible to be given to at least some regional centers. I know they are very expensive, the ARVs of that third line, and there are few people on that line, but getting them, accessing them, is a little bit hard, leave alone bringing them, those who bring them on the list of the ARVs that we should be given to people. At times, this guy almost actually lost hope until I talked to AIDS Commission, and I thank you that you responded, because there was nobody who had that type of drug. I had even to bring it on the floor of Parliament for the ministry to respond. So we still have that challenge, how I wish it could be also responded to. I thank the president that he's coming out to talk about AIDS and also supporting it. I know we have development partners. They have also done their part, but with this problem that we had in passing this law, which did not please them, they are now, some of them are up in arms. But the president is positive, and he's still insisting that we can continue to increase the funding. And I thank you, Dr. Bagambe, for you have told us that there is at least some promise that they are going to increase on the budget. I think it's high time that everyone, each one of us, now start thinking of how we can support ourselves in as far as HIV/AIDS is concerned. You might not have money, but you have the mouth. When you talk, someone will not get the infection. because the infection, the new infection, you have seen in the report, it has gone to 51,000, which is a big number. Actually, Bagambe was telling me it has gone down. It seems the COVID period, people relaxed. And in the relaxation, you were excited and became happy, because that's when it went to 54,000. But now it is 51, which is also a positive one. So we thank him so much that he's still positive and he's still accepting that we increase the funding in AIDS Commission, which is our coordinator for all the AIDS agencies and sectors that are holding this problem, the scourge. I would like to say that we should now start preparing to leave. But before we leave, allow me again to also thank those people who are living with HIV AIDS, because you have been a good family that you don't keep it to yourself, but some of you have come up to sensitize others so that people don't get it. Because you can easily say that, after all, I also got it. Why don't you get it? But you come out like Michael. Michael, we want to thank you because I know you represent the youth, and it is the youth which is vulnerable. So thank you, and please we urge you to continue and even recruit others to come on board so that we fight this disease. It is still there, and we still need a lot of preaching about it. I would like to thank also the people in the music industry, the musicians. Some of them have followed Fide Bongore Lutaya to at least talk about it in your composition. And you know, people listen to this music and take the words. So kindly continue being creative, and in whatever songs that you sing, don't forget AIDS. Because people, during that time, when it was still high, there were many people, messages from the music, but it is now coming down. So I also urge you that, don't you see that what you did here energized us and excited us? What about if you are doing it somewhere and where people would say, hey, what are they singing? Then they will listen about the message. And if someone is trying to mess around, we'll stop there. So thank you so much. Thank you, Mr. Dong, with your group. This song, the last song you sang, is our parliamentary theme. Because when it is sung, everyone jumps in the air. If we have any function, you notice it, everyone will jump. And the reason is, that is the song that our late speaker, Honorable Jacob Olanya, used to love. So he left it, and when you sing it, actually when you sing it, at times it goes in our head negatively because it makes us remember, but at the same time, it makes us remember what he used to love. So thank you so much. Honorable Chambade, I will not leave this stage without saying thank you for giving us that keynote address. It was so good. And thank you for keeping there, and we thank you for what you are doing. We know you contributed a lot, and you are still contributing a lot for this country. We don't take it for granted. Last but not least, thank you again, AIDS Commission, for this symposium. I know you are preparing for AIDS Day, which is fast, and we look forward to see that many people will be kept awake to know that AIDS is still with us, and they should also be part in fighting this scourge. With those many words, I would like to stop here and thank you for attending. Thank you for being there in this weather, which has now started showering. I had said that it's not going to rain, and it did not rain. It is only that you did not keep time. But if you had kept time, we would have finished without the what? Without the rain. So my prophecy is still standing. It did not rain. It rained out of your time. Thank you so much. May God bless you. They told me that there is some word that I did not mention. That with those many words, I now officially close this symposium. Thank you so much.
Thank you very much, Honorable Naomi. Ladies and gentlemen, the entertainment is going to continue, and exit departure is at leisure, but this marks the end and closure of the 3-day symposium on HIV/AIDS. Until then, God bless you. Take good care of yourselves. Young people, take good care of yourselves. We need you alive in order to guarantee the future of this country. God bless you all. The World AIDS Day 2023 is going to be commemorated in Rakai on 1st of December. So look up to that occasion, a very important occasion in the fight against HIV/AIDS. Thank you.